Appreciate you, my love. Enjoy your workout. Work it out for me, girl. Get it going. Yeah, should be live now on YouTube, Daphne. So you should see me now. All right, cool. And then now I'm on Instagram. All right, so I should be streaming now on Facebook, multiple Facebooks because I have multiple Facebooks, LinkedIn, YouTube, and my IG. So we should be good. We should be live now. Hey, Melly, woo, woo, woo. Welcome in, welcome in. All right, cool. So I think we're good to go now. I think we got it. Daphne, if you do a little quick check for me, make sure you can see me. I think we should be good. Perfect. Yay. Whoop, whoop. Perfecto. All right, cool. Let's get this party started. Okay, so if you're new, welcome. We are in Intro to Holistic Medicine, week 11. As you know, if you've been following me around this crazy journey, I've been traveling. I'm back in the America KKK. And so I have been traveling. Yeah, Gucci. I love it. So yeah, I've been traveling, trying to get my the rest of everything kind of like settled out in the United States, turn my car in, get my storage units all sorted out. So I've got about one more week here to get her done. So that's what I've been up to. So I'm a little all over the place and I apologize, but it's okay. We're in week 11 of a 12-week course. So Intro to Holistic Medicine is a 12-week course, and this is Intro to Holistic Medicine 1, which is focused on nutrient deficiencies. It's done. I teach it in 3 parts. It is a self-guided course, so you can pick it up anytime. Like if you're just finding me, you can click the link in the bio and register. I did have a couple people that requested. I haven't had a chance to, invite you in, and I'm definitely behind in this week's info, but not to worry because I will get it caught up today. It's just been crazy with all the travel, and then my internet has been slow. So I've been working on that. Okay, so Intro to Holistic Medicine is a 12-week course. 1 is focused on nutrient deficiency. We will take a 3-week break after next week. So next week is the final week of Intro to Holistic Medicine 1. And then we'll take a 3-week break to just kind of get caught up, make sure everybody's sorted. Anna. So welcome in, Anna. And so to make sure everybody gets sorted, I'm like so behind in your class, Anna. Oh my gosh. I've been traveling. I need to speak to my advisor. So anyway, it's a 3-part course. The first week the first part is 4 weeks. We build a foundation of holistic medicine. What is a foundation? So we look at subjective and objective data. What are those words? Subjective, what the patient tells us. In this case, we use a questionnaire, a nutritional assessment questionnaire, and then we combine that with objective data. What's objective data? It's something outside of me, something outside of you, something I can measure. So in this class, we're using our salivary pH and our heart rate. On the first part, we kind of learned all about that, how to take that data, etc. Second part, we worked on modalities. So we worked on nutrition, we worked on stress management, we worked on movement, we worked on something else. We worked on remedies, natural remedies, like some digestive supplements and supports, right? So we did that, and now this third part, hey Waverly, this third part is all about kind of pulling it all together and building more of like more of a treatment plan. First for yourself, I really want you to make sure you have it for yourself, but then also too, building it out for your patient. So we're working on a 12-week for you and a 4-week for your patient. Again, I'm probably not going to have you do both for your final. I'll probably have you pick one, whether you want to do a 12-week or a 4-week. But today we're going to kind of break down what a 4-week treatment plan would look like. and kind of how to walk you through that. We're also going to get more into Blessed High Rising. We're going to get more into terminology to make sure everybody's on the same page, because standardization is key. And we'll get into some of also the natural health providers, so you kind of have a little bit of an understanding of the differences in education. So we'll be here for at least an hour, hour and a half. We're scheduled for 2 hours. And so every Saturday, we're in week 11. Again, it's self-guided. Next week is our last week. And then we'll take a 3-week break for everybody to get caught up. And then I'll start in an intro to holistic medicine 2, which is all about detoxification. So that'll be fun. In intro to holistic medicine 2, we'll be talking all about, we'll be using our detoxification questionnaire, which is an environmental studies questionnaire. And then we'll be using urinary pH and then bowel transit time. So definitely going to be good there. So, all right, perfect. So we're going to get started today in designing more of a patient-centered education plan and ethical communication in practice. So let's go. All right. All right. So our objectives for today are, I feel like Vanna White. Why do I feel like Vanna White? Hold on one second. Let me go back. All right. Our course objectives for today, hopefully you can see it. If not, I really recommend you go over to the YouTube because you can see it better on YouTube. So we're going to build a 4-week educational map for our patients. We're also going to identify legal and ethical boundaries. We're going to understand education and its educational benefits. I know that right now people are like education phobic for some crazy reason. People don't like books. They don't like reading. I don't know. I'm a school kid, obviously with 7 degrees. I love school. Like, give me a paper, give me an APA format. Like, I will make it the world. But a lot of times people don't get it, so we're going to make it more accessible. We're going to practice layered learning, evaluate communication, and look at different integrative, holistic approaches. So definitely a lot to cover for today that we're super excited about. We're going to do a little check-in. So like I was saying, as kind of what I was getting set up, is that my internet is slow. So because of that, I haven't had a chance to upload everything. Like literally, it's fighting for my life. And so today or tomorrow, I'm going to work on trying to get everything uploaded into the core shell. So if you've been into the core shell, you'll notice that like nothing's in there, Dr. Steele. It's because everything's been super slow. But not to worry, we'll have a 3-week break where we can all get our life together. I'll still be going live in the 3 weeks. I just won't be like teaching a class. I'll be doing like more of an impromptu. You'll be, hustling and bustling with me all around the St. Lucia. Okay, so that's what we're going there with. All right, so I think that's my next slide. Hold on. All right, cool. So just so we are clear. All right, here we go. Let me try to, I don't want to I want to still see my face. I feel like it's weird to not see my face. Start a flash goal, whatever that is. Flash it up. If we get 3 people to send a puff, I get my flash goal. Okay, so when we are structuring, remember we kind of did a 12-week plan for others, but if we are structuring this for a patient, so if we decide to do a 4-week plan, this is kind of what we would do for a 4-week plan. And there's a specific structure that I follow when I'm working with patients. Why? Because after 40,000 patients and taking data on those patients, I kind of figured out a little something. So definitely listen to me on this. It's going to make your life easier. The first part working with a patient is mindset. I know everybody wants to jump into the to-dos. They want to jump into the water and the food and the supplements and the this and the that. But unfortunately, if you do not check a patient's mindset first, they're not going to follow through. I had somebody who did a discovery call with me last week, and they had been to other providers. They'd been to a holistic person. They'd been to this person. They'd been to that person, but they weren't following through, right? And so I had to break it down to them to help them to understand, mindset, prioritizing self, which is part of your environment and your relationships. So I realized pretty early on that if the patient doesn't have, a clear mindset, number one, and the patient's emotions were not in check, number two, their actions, habits, and behaviors would not follow through. And that would be, and it didn't matter. These are people that would come in super excited. They would pay their money. Like, it wasn't even a thing. They'd have time to do it. It was literally not having that mindset and that emotional follow through that broke down the actions. And that's kind of how I figured out, oh, wait a second, we really are approaching this wrong. We need to first work on mindset, work on a patient's emotional resilience, because life is lifing. And so if a lot of times patients don't have emotional coping skills. And if they don't have emotional coping skills, guess what? They're going to waver in the process. So the first week, when we're working with our patients, we're going to work with their mindset, their habits, and nervous system regulation. Why are we going to work on nervous system regulation? Because if they are in a fight or flight mode, meaning they're always ripping and running these streets, right? They're not going to slow down to get present, because all that energy is being used now to rip and run. And so we have to kind of get them to take a step back and be more self-aware and more self-reflective, and really truly be honest with themselves to see what their habits, lifestyles, and behaviors truly are, right? So we take a step back from that. We teach them about mindset. We position them in the right mindset so they can have the follow through, right? And so we want to shift them from that fight or flight state into that rest and digest state. And a lot of times, what I found is most effective is vagal nerve stimulation. If you're not familiar with the vagal nerve, if that's totally new to you, it actually runs through that subclavian, it runs through your midline, and it regulates your parasympathetic and your sympathetic response, meaning it regulates your rest and digest, which is more of your relaxation, and then your fight or flight, which is more of a trauma response, a survival response. Some of us were born in a trauma response, and some of us have intergenerational trauma that has definitely taken hold, and we are constantly in this rat race. Also, too, regionally, like I was just in New York, I'll be going back to New York as I fly back out of New York, is that, like New York, a city like that is like everybody's in the go, the fight or flight mode. So even if you personally are not in fight or flight mode, just being around the humans and being around that energy can take you into that. Also, if you're living in a house, right? I have another patient that just started, and the dynamic is like, whoa, like I can see why one of the partners is experiencing stress from the other partner, just because the other partner is more in that fight or flight, and then the other partner is kind of more laid back. And usually that works. Like, I'm definitely more of the high strung one. My husband's more of the like balanced, mellow, calm. And so we balance each other. So it's not, there's nothing wrong with that. But just so we know, we can be influenced by the people around us. And so that's where, again, I got into environment. I was like, wait a second, the more the environment that we're in is also going to play a role. Even if your environment is chaotic. What do I mean chaotic? Like, if you have stuff everywhere, like if you are pack rat, hoarder, or even just disorganized, that also is going to play on your nervous system and send you in more of that fight or flight state. And so you don't recognize it, again, because you're ripping, running, and doing, and all the things, right? And so, hey, don't sip. So making sure, you do take it down and learn how to re-regulate. We worked on all of this during stress and stress management. That whole week, we worked with the heart rate a little bit. I also did another master class just on heart rate alone. So teaching you how to shift and move your heart rate up and down depending on where your stress responses are. So we do have an objective analysis on your stress. So it's not just subjective, what you think, because some people are just strong people. Like, they're like, my husband is super strong. Like, I don't think anything affects him, honestly. I'm like over here melting down, and he's like, everything's fine, So, people process stress differently. Some people internalize stress. Some people just vomit on everyone around them. So depending on where you are, the heart rate is a great way to check Optimal heart rate is a 70. If you're too low, it definitely lets us know that your body can't really handle, that you're in chronic stress overload. If you're high, it can, if you're not like super working out all the time, that can also indicate, different response and just in terms of how you're managing your stress. So there's that. Then week 2, when we're working with our patients, we're going to start slow. We're going to get them into their drinking their water. You can live, I think, up to 45 days without food. And I'm not talking about no breatharian stuff. So don't go there with me with that. I mean, it is a thing. I get it, but we're drinking water over here. So you can live up to 45 days with no food, but you can only live up to 4 days without water. I know people like to say, oh, like I've seen some people like health influencer lady who's like, I haven't drank water in years. I'm just getting it from my fruits. Okay, I'd love to see what her lab work looks like because, I need my water. Water helps you to flush. It helps you to detoxify. It's a natural detoxifier. And there are so many various different symptoms. I will do a whole masterclass on water. Maybe while we're on break, I'll do a class on that because water is such a big topic and hydration and getting hydration in your cells. Hey, Queen Sheba. So, okay. So the second week is about hydration that you're working with the patients and teaching them how to track, right? Because again, we're not designed, we're not trained to do that. Most of us, we think we're okay. We think we're fine. We eat healthy-ish. And then, we stumble into the doctor. The doctor looks at us and says, oh, we're fine, which really is just we don't have a disease. And then we go on that, right? So I teach you from a public health perspective and also from a functional medicine perspective. I teach you how to take these metrics with yourself at home. We have a companion app as well. It's totally free that you can use to track your data as well. You can also pop me a little message if you have any questions. Hey, Nina, welcome. And so, again, it's not just how you think and how you feel. Feeling, I know people are going to fry me for this, but feeling is almost superstitious. And why do I say that? Because I can have a feeling for something and be totally inaccurate, right? Now, don't get me wrong. I trust myself. I trust my intuition, all that. But when it comes to our physical, tangible health, we can't just base it off of our symptoms. I would have patients come in, hey, Emmanuel, welcome in. I'd have patients come in and they say, oh, I'm fine. Everything's fine. And I look at their lab work and their lab work would be horrid. And then all of a sudden I'm like, okay, let's start to build some association because some patients will disassociate, meaning they will completely check out. They're not present to their body, especially if they've been through trauma. So keep those things in mind as you're working with patients. Then the third week, when you're working with your patients, you're going to be looking, hey, Mystical, you're going to be working with them on their lifestyle, their environment, and a long-term structure for fulfillment. And so we talked about that structures for fulfillment when we went into that class. I think it was a Saturday class. And so it should be in the core shell by now. And so the structures for fulfillment was a way that we execute, on our lives and on our day. It's a way to organize our time. Hey, Zen, and welcome in. And so really helping the patient to determine a structure so that, hey, Alberto, that they can thrive. Because otherwise, if there's no structure, they're not going to be able to sustain. Hey, forever student, welcome in. Hey, Z, they're just not going to be able to sustain anything that's going on. So, and life is lifing. And so anytime you create a plan, what does the universe say? The universe laughs, right? And so because of that, we want to give people that tangible plan. And again, this is really subtle. This is really structured. So you may have these things planned, but then the patient comes in and maybe they lost their job or, their husband is going nutty or, their child or, they just say, hey, easy going, or they, had a big move or whatever. So keep that in mind that even though these are the way that we structure it, you're going to want to move with the patient. You're not going to, try to push the patient farther ahead. Oftentimes, hey, Tata Kisses, oftentimes I will literally just listen to my patient and see where they're at before I add new things. Like I don't just overload them with a billion things. In fact, I'm really sensitive to where a patient is because I know they're going to get it, right? But I want to make sure that they actually create this as a lifestyle because the purpose is for them to live without me, right? The purpose is for me to retire in beautiful St. Lucia with my beautiful husband and not be bothered, right? And so in order to do that, in order to facilitate that, I have to teach people what they don't know about their health and then help them to really embody it. So then in week 4 is we're working with our patients. Hey, Jay Friendly, we're working with our patients. We're structuring, now we're talking about digestion. Now emotional health will come in, symptom awareness. Hey, full moons, because people will begin to associate their food with their emotions. Most of us were not taught emotional coping mechanisms. Absolutely, my love. Most of us were not taught emotional coping mechanisms. So what happens is that most people will use food in order to pacify and soothe. I know some people are like, I don't do that. We all do that, unfortunately. It's just our conditioning, and so we can break out of that habit, right? And again, I've done this work myself. I never in a million years would have thought, oh, I don't do that. And sure enough, when I was doing mindfulness, in fact, in our course, there is a 30-day mindful eating workbook that you'll be able to download and go through to really build mindfulness around your food, because you don't know what you don't know about yourself. And so building that self-awareness and going, when I was doing that work, I couldn't believe somebody would tick me off and I would go and like go eat something, and like angry eat. And I'm like, what in the world? Hey, Fit Mom CEO. Hey, Bear Maple. I was like, what? Like, why am I over here, like hate eating, but really it is an emotional response. And sometimes we just don't have, the coping skills in the moment. So a lot of times when we start working with patients with their food, we will see that we will see those emotional connections that start to come up. So that's pretty much a 4-week structure. And again, I like to do 12-week structures because it gives us some time and it gives us a little bit of breathing room. But I wanted you to see what a 4-week structure looks like. It's really fast. Typically, again, even if a patient is a self-starter, even if they're super motivated, they still may waver in this 4 weeks. So I would, as a billing perspective or as a treatment perspective, I wouldn't just give them a 4-week plan. I would probably give them a 6-week plan to give them a couple weeks just to play with, because you never know what's coming up. And then it gives you an opportunity to upsell them into a 12-week plan. I really love the 12-week plan. I mean, patients with me work with me for a minimum of a year because, again, as we talk through behavioral change, it takes about 6 months for patients just to get the hang of it. And then, you're reinforcing, reinforcing, reinforcing. So try not to stress yourself out. Try not to stress them out by, going, oh, okay, so we're on the mindset this week. All right, cool. Next week, we're on the water. Okay, this week, because sometimes you may leave your patient behind. And when you're really being present with your patient, you're actually going to be walking side by side with them. And that's where this active listening, hey, thank you for the heart me. That's where active listening really comes in handy. So keep that in mind. All right. So let's talk about, thank you for the roses. All right. All right. Scope and ethical discussion. Oh, Jesus. Okay, perfect. Okay, so scope and ethics. All right, so there is a difference between coaching and diagnosing. And on the socials, I see the craziness all the time, right? So we we are not diagnosing and managing diseases. So what I'll see in different groups, I'll say, oh, what do I do to treat XYZ condition? What do I do to treat XYZ condition? And remember, you're not treating that condition, you're treating the body, and you're treating the body's ability to heal itself. Okay, so the diagnosis is just a symptom, unless you are licensed to diagnose and manage. And even still, I honestly, hardest to hearts, I think diagnosis is such a waste of time. I think it, it gives people a little bit of something to grab onto, but it's more of an emotional thing, because healing it is still the same. You still have to go through the various different systems and function, in order to facilitate healing of the body. The body already knows how to heal itself. It just needs support. And so that's what we're doing, is providing it support. We're not labeling the body as diseased and then managing that disease. That's not how we do it. And also, too, we don't go chase after bugs. I know people like to do that. They love to go chase after Lyme. They love to chase after bacteria. They love to chase after, viruses and parasites. Remember, all of these things live because of the environment that they're in. They can only create harm if it is an environment that's conducive for that. So keep that in mind. You're not treating a disease, you're actually teaching a patient what they need to do in order to facilitate healing. And then we're going to talk about, kind of, again, inappropriate versus not appropriate things to say legally. You cannot cure things. Okay. If you say cure, you will be slapped with I think it's a felony to practice medicine without a license, or at least a misdemeanor. So you're not diagnosing things, you're not curing things. That was what got Dr. Sebi all hemmed up, because he, from Honduras, he didn't know the gangster medical monopoly we live in. And so you can't say that you cure. What you're doing is you're supporting the body's ability to heal itself. Also, too, you're not, again, diagnosing and managing. So I don't want to see any of my students going in and saying, oh, what do I do for this disease? Here's what I do for this disease. No, you're treating the individual human being, right? Because I can have 2 diabetes cases and they can have 2 separate treatment plans. Just because a patient has been labeled something does not mean that they have the same standard of care. That is conventional medicine. That's what they do. They look for and identify and label something, and then through that labeling, then they manage it using a pharmaceutical, a procedure, or a surgical intervention. I am going to go run downstairs and grab my DoorDash. Okay. And so, because I ordered myself some breakfast, so I was trying to be like on time-ish. So I'm gonna do that because I want my coffee. I'm gonna go do that really quick, and then I'll be back. And then when I come back, we'll talk about the confusions of titles, because they're not all interchangeable. Like, a naturopath is not the same as an integrative medical provider. It's not the same as a holistic doctor. It's not the same as a functional doctor. So I'm going to distinct that. We talked about that a little bit on Wednesday, but I'm gonna bring it home for you guys. All right, hang tight. Talk amongst yourselves. I'll be right back. All right, I'm very excited about my coffee. We don't have these little fancy things. Actually, you know what? I lie. We have one place that has the fancy coffee, but we don't really get it that much in St. Lucia, so it's kind of fun. Okay, thank you for the follow. Okay, so here we are. All right, holistic. All right. So I say I'm a holistic doctor. Why do I say that? Because I have 7 degrees in my field, right? What are those 7 degrees, right? Ugh. Wow, the fancy coffee doesn't taste too hot. Oh, you know what? It just settled at the bottom. Okay. So holistic doctor, I'm not going to go through all the degrees, but we deal with a lot of psychology. We deal with the spiritual, we deal with the mental, we deal with the emotional, we deal with the spiritual. We deal with different aspects of the human being, not just the physical. We also deal with what would be considered applied psychophysiology. So, how the mind and the emotions create physiological responses in the body. So, we deal with a lot of trauma and things like that because of that, and how trauma really gets trapped in your body. So there's a lot of different aspects of it. Hey, Mr. Paychecks, or Paychecks MX. I don't know if it's this. Okay, so that's what makes it holistic, right? Because we are looking at different aspects. We look at the physical, the environmental, the mental, the emotional, the spiritual, psychosocial, spiritual, and the ancestral component. So I have training in all those different areas, formalized training in all those areas, right? And so that's different from naturopathy. So I'm a board certified naturopathic doctor. Naturopathy is a distinct training from Dr. Benedict Lust. He came from Germany with neat water cure back in like the early 1900s. That has its own specific practice. There's two types of naturopaths, which we'll talk about. There's a traditional naturopath, which I am, last of the Mohicans over here, and there is a naturopathic medical doctor who is a hybrid trained doctor. And hey, Ansley Pansley, and actually, naturopathic medical doctors are dual trained. I don't think that they're trained. I've legislate against them all the time. They have a little bit of conventional training in it, and they also can prescribe, and in some states prescribe opioids, which is crazy work. But they have some conventional training, no residency, by the way, some conventional training and some natural training. So they're kind of the jack of all trades, master of none, in my opinion. I have some friends that are naturopathic medical doctors who I love and who are great and are talented. So it's not a bash on them. It's just theoretically and philosophically, I don't agree with combining the two practice. I think if you want to be a medical doctor, go be a medical doctor. If you want to be a naturopath, go be a naturopath. I just don't think that they work together in the same human. Okay, so functional medicine is like a systems approach. There is a functional medicine training. Yes, there is training and education in this. You have to be mindful, especially as a consumer these days, because medical doctors are getting hip that patients, aren't really trusting them. So they're hanging their shingle out, and I see this in my doctor groups all the time, and it drives me bonkers. And I'm surprised I haven't been kicked out by now because I always speak out against it. But, they will hang a shingle and have no training in functional medicine. So in my training, in my second doctorate degree, I did about 2-year training in functional medicine, because functional medicine is all about the labs, right? So every lab underneath the sun, I wanted to learn those babies and learn them inside out, right? Which is why I start to teach you in office labs, at home labs initially. And then if you follow me and want to become a holistic doctor, then we'll get into all the functional labs and building your own lab and all that craziness. And so, you know, I did a 2-year in my second doctorate, and then I did a 2-year postdoc just in functional medicine, because there's nuance to reading labs. Reading labs, it's a skill, number one. There's a hard science to reading labs, but then there's an art to reading labs too, right? And one of these days I'll come, maybe on our break I'll show you kind of the art form to reading these labs, because it's not just, that's why a lot of times people will go to a conventional doctor and the doctor goes, oh, your labs look great, oh, your labs are fine, when clearly you have all kinds of things going on. There's a lot of nuance to the labs that if you're not trained in, you won't catch. So a lot of times in the medical community, they will hang their shingle in functional medicine, maybe get a little bit of training, and there's all kinds of different types of training like IFM, but I went through FMU, and by the time IFM came around, I just thought it was way too simple. So, but it was it's a really good bridge program for conventional doctors, because again, if you're a conventional doctor, you're trained to diagnose and manage. So you're going to take that diagnose and manage model into a natural realm. But we don't diagnose and manage. We're dealing with how the organs are functioning, the environment, right? And so as a naturopath, I had very much an advantage because that's how our original training was. And then from there, so I would definitely seek out a naturopath who has functional training if you're interested in functional medicine, not necessarily an MD who's crossed over. Not to say that they're not amazing MDs. I've trained with some amazing MDs in functional medicine. Like one of my mentors who has passed away, he, it was a psychiatrist. I've actually had two mentors that were both psychiatrists. Hey, how are you? Yeah. So, who were a psychiatrist, right? And so it was nice because I got that mental, emotional side of it. And then I got a lot of exposure to the world of more functional psychiatry, which led me into applied physiology, psychophysiology. All right. So that's kind of functional medicine. It's all the laboratory. And then we have integrative medicine. So, integrative medicine, you can be a conventional trained doctor or not, but you really need to understand, the basis of conventional medicine, meaning you need to know what happens if a patient needs a cardiac workup, or what happens if a patient needs a cognitive workup, because you are integrating with conventional practice, meaning that you are now working with your conventional doctor. So I would refer to my conventional doctor. So like, let's say I did a lot of oncology and hey, present day. So I know, baby, I know. I pray for you. I pray for you. And so, that allowed that I actually did a 2-year, again, integrative medical training. And what that did is it taught me a lot about the conventional practice. And that way I could refer to conventional doctors and they would refer back to me. Right. And so because I'm dealing all in data, right, with my functional medicine training. So if, let's say, a rheumatologist referred a patient to me because the patient didn't want to be on meds, they didn't want to be on the, steroids or whatever, or the immune suppressants, they would refer that patient to me and I would know what to do so that when that patient was seen by their rheumatologist again, their numbers were improving. I will tell you that is how I built my practice. It was not handed to me. In fact, I was looked at as a leper when I crash landed in Virginia. They were like, who is this chick? She's got dreads. We don't trust her. We definitely don't trust her dreads or locks, rather. And so we don't trust this lady. We don't know what she's talking about. She's going to tell our patients crazy stuff. And so, I really had to earn that based off of the results that I was getting with their patients. And so eventually, or patients would have me come to their appointments with them. Oh Lord, that was like a whole trip, right? And so, working with conventional doctors over the years and learning what their standards of practice are, but also to having that training in integrative medicine to understand, okay, what does cardiology do? What does internal med do? What does primary do? What does, because you need to be able to refer, because their system is built off of, you have primary who's going to refer all over the place. Pretty much they're just like a grand central station. And then you have all of these specialists, and what does the specialist do and what their scope is and what their standards of care are based off of what you're looking at. So if I'm looking at a patient's lab work and I'm looking at a patient's, medical records, and I'm saying, there is a disease process that needs to be managed, because that's really what they're good at. They're more of the disease managers. Like they watch the disease and make sure the disease stays in check. Sometimes by the time a patient comes to me, their disease has accelerated, right? So every given moment where they're building health or building disease. And so we want to catch the patient sooner rather than later. Actually, in my legislative days and my lobbying days, I worked with pediatricians, believe it or not, who were very like side-eyeing me about the vax. And so, but what they would tell me is, we're not really trained in prevention, and I was so grateful that they were honest, because they're not, they're only trained to diagnose and manage a disease. So if you don't have a disease to diagnose and you don't have anything to manage based off of their standard of care, they don't know what to do with you. So you often get dismissed or medically gaslit because of that. So just keep that in mind, as we're going forward. So remember, also too, I want to distinct this out too, because, and we'll flush it out even further, but there is this thought process that I'm not a Western doctor, right? So again, right, just because it's natural doesn't mean it's not Western. Western is a system, right? So in Western medicine, we are trained in anatomy, physiology, pathology, biochemistry. We're trained in what we call the biosciences. Hey, Melly, we're trained in what's called the biosciences, right? And so that's different than Eastern medicine. Eastern medicine is based off of all the energetic systems. So like your meridian system or your doshas or, your chi or your prana. And so these systems, as a holistic doctor, we work with both, right? But we're primarily trained off of our Western based model. I do lots in the bioenergetic space and the bioenergetic world, especially with the CV19 injectable, the inoculation, because that it affects you on a DNA level. There's no way to naturally detox it out. So people that are like, oh, take zeolite and take bentonite for the COVID vaccine, no, that will do nothing. For traditional vaccines, yes. But for the COVID one, no, because it's mRNA. So it's actually teaching your genes to do something. So in those cases, we use bioenergetic frequency. So you'll see we use a lot of machines for that. And again, that's based off of Eastern practice, right, of frequencies, right, similar to homeopathy based off of frequencies. So there is a distinction between our Western medical system and our Eastern medical system. So a holistic doctor is trained in the Western system, but we also use those Eastern models. We pretty much combine both Eastern and Western. Now, would I say that I'm an Eastern doctor? No, because I primarily use anatomy, physiology, biochemistry is pretty much what I use every day. Okay. Hey, John. And so every day I use Western med. And so again, we've got to use the proper terminology. We are Western trained. I'm going to be teaching you in Western med, right? What is Western med? Hold on, let me do my little puzzle. They do the puzzle. Oh my God. They stress me out all the time. I'm like, oh my God, I'm not going to get the puzzle right. Anyway, so the Western med, we're trained in anatomy, physiology. That is our structure that we work with. Whereas in Eastern med, they're going to teach you based off of like either the doshas or the meridian system. Like acupuncturists are trained specifically on Eastern med. They're not trained in Western med. They do get a little Western med in their training, but they're trained off the meridians and they're trained to detect that. Same thing with Ayurveda. They're trained in the doshas. That is their Eastern system. And so we want to understand that these are systems that are built. So thank you, Fit Mom. Appreciate you. And so we want to look at that. All right. So coaching, when we're getting into coaching, so I'm teaching you, so eventually some of y'all will go on to a holistic health coaching program with me. So I'm teaching you how to coach, I'm teaching you how to motivate, inspire, listen, and help people with behavioral change, right? That's different from consulting, and that's definitely different from treating. So we want to make those distinctions. So again, we're not click up, you're not on the lockup talking about, I didn't know. Right. So we want to make sure that, because again, if you are out there saying the wrong things, it can get you in trouble, even if you're not doing anything wrong. If you're communicating and using the improper terminology, the wrong person. And let me tell you something, from somebody who's been in this field for over 20 years, they will come for you. Okay. Who is they? Right. They is anyone that profits or benefits off of the current medical monopoly that exists, right? They make a lot of money off of people being sick, right? And so I had to spend copious amounts of money and attorneys fighting and resisting. And again, making sure all of my legal communication and my legal communications were accurate. Because again, I mean, I was out there. I'm a big human. I love to be out there. I love people to see me. So I was on TV. I'm on this. I'm at that event. I'm at this event. I'm doing this. I'm doing that. Right. And so I'm not hiding under a rock, scared, right? I'm out in the open going, nope, I'm a natural medicine doctor. I'm a holistic doctor and I'm here to help, right? So what's going to happen, right? The conventional model is going to be like, no, you're not helping these people. We're making too much money off of all this. So just know that the more that you put yourself out there, the more, that you're going to get. Now the tides are turning again, yeah, exactly. I know. Yeah, because yoga comes from India and Ayurveda. And so, again, the tides are turning, holistic medicine is more accepted, but unfortunately, it's getting more diluted and then improperly trained people or people that are self-trained and not formally trained. And that was one of my inspirations behind, building a school. Before Trump won the election, I was actually going to be helping the naturopathic people in the United States to be able to help with the DOE, Department of Education, and help them to facilitate their educational standards. However, most of my colleagues voted for this individual. And so because of RFK, and so I have my morals and I have my values. And, I don't know. I believe in Black people having rights. I believe in Black and brown people having rights. I believe in women having rights, just these funny things. So because of that, I said, yeah, kisses, I'm out. And so I resigned literally the day after the election and decided to build my own schools. Oh my gosh. Robin, I feel like I need therapy with you now because so many, and it's not just the YT chiros, it's the YT medical doctors too. They're out here professing and know nothing. That's why I said, you know what? Okay, I'm not gonna build a naturopathy school. I'm gonna build a holistic medicine school. And we are going to retain our Afro-Indigenous practices because these were things that we practiced well before any colonizer stepped foot. These are our things. And most Black people, we've had a mom or a grandma or somebody who taught us, hey, take this instead of this, take that instead of that, right? My husband literally grew up just on bush medicine in St. Lucia. So, we want to retain our practices. Yes. One tell me Black people have allergies due to smoking and oh Lord. Yeah, exactly. And they're harmful. They're absolutely harmful. And then let me just say this. Look, what is it? Gabor Mate, right? If I listen to him one more time talk about trauma, I get it, right? I get it. The Holocaust was horrible. However, and I'm not oppression Olympics, but Black people, we have experienced intergenerational trauma. Mental health is still affecting, addiction is affecting. So much of our intergenerational trauma is impacted, and we cannot heal it on the psychological level alone. We need it on the spiritual level, which is why I got into family constellation, which is a whole nother conversation. Hey, Mad King. So we need more properly educated Black people to be able to treat us, right? We cannot heal with our oppressors. I don't care what anyone says. I cannot heal because my nervous system can't relax because I never know what angle even if they're the nicest and sweetest, they have inherent biases, they have, inherent racism. And so, that is not conducive for healing if I never know what they're going to say or what they're going to do, especially if I don't agree with whatever protocol they're doing. So again, this is why I built this school is because I really wanted to teach Black people how to treat other Black people, right? And not to say that, all people are not welcome, all people can come, but that was really my focus, is really us keeping holistic medicine for ourselves, which is why we distinct out holistic medicine is a way different practice than naturopathy or functional medicine or integrative medicine. There's overlap, right? But holistic medicine, we deal with the spirit, we deal with our ancestors, we deal with internal healing. There's so much more, so much greater, because we have that wisdom within ourselves. We are originators to this thing. So definitely keep that in mind, as we are going along in this world. All right, so now we're going to get a little bit deeper, deeper, deeper. All right, here we go. So Western medicine, again, is anatomy, physiology, pathology, biochemistry. However, conventional medicine, right? So remember, there's conventional medicine, and you can also use the term allopathic medicine. Allopathic medicine, so in the beginning, there was allopathy and homeopathy, which we'll talk a little bit about homeopathy because it's a bioenergetic practice as well. I'm actually an expert homeopathist, and so I love homeopathy. So beautiful. So Western medicine is that study of, but conventional medicine, meaning a conventionally trained allopathic medical doctor is trained, or any of the subsects like an NP or DO, et cetera, is trained to look for and identify and diagnose a disease. Now that has all been categorized, right? So now, like I said, now they're trying to bring up Trump derangement syndrome, right? Now they're trying to pretty much gaslight us. But you understand, that's how they create these things. These models have been around, and that's why the DSM and me do not get along. And so when I went through my psych training and they're like, oh, the DSM, I said, oh, hell no. I am not going to, subscribe to this, right? Because again, there's a lot of nuance. There's a lot of, aspects that affect us, especially when it comes to trauma. Oh my God, Rasta D. There's my beautiful husband. He's coming in to show. So anyhow, we want to make sure that we, distinct out, that conventional practice. The conventional practice has been already categorized by all of these, powers that be, et cetera. And they have gone through and pretty much created these disease processes and then expect everyone else to live inside of them. And they may or may not apply, right? So for instance, let's look at diabetes, right? So they say diabetes is, blood sugar dysregulation, the pancreas, all the things, right? Well, diabetes also comes from someone not being sweet to themselves, right? Or having a lack of nutrients. So if I've had a lack of nutrients and I'm not sweet to myself, what am I going to do? I'm going to go to my food and eat sweet things, right? If I continue to eat sweet things, what happens? My glucose is going to spike up and down. My insulin is going to be all over the place. I'm going to be sensitive to it. Eventually I'm going to build resistance to it. That's not a diagnosis. Like if I said that, I did say it on the doctors and one of the doctors liked it. So that was fun. But, really we have to get out of this more standard structured way of thinking when we're coming to a diagnosis. Diagnosis is very reductionist. And so what do I mean by reductionist? It literally just goes to one cause. There is not one cause. Like for right now, the crazy RFK, is trying to say that autism is just one cause. No. I have seen a full spectrum. Again, it's a spectrum, right? Some patients have genetic predisposition. Then they have environmental triggers. Then they have nutritional deficiencies. Then they have, there's so many different things that now impact it. It's never one thing. And so we are trained in this reductionist thinking that it's even diabetes. Oh, it's just your carbs. Well, no, it's not just your simple carbohydrates. It's also a lack of protein. It's also liver toxicity. A patient, I've seen a lot of my diabetes cases, the liver is just really, really toxic. And so what does that do? It creates more stress on the pancreas. And so the pancreas can't develop that insulin sensitivity because it's trying to deal with so much on the liver end. And so again, this is why in holistic medicine, right, is more, we're looking at so many different aspects. We're looking at physical, we're looking at environmental, we're looking at mental, emotional, psychosocial, spiritual. We're looking at all of these different aspects, of what makes us a human being, rather than going, oh, I'm going to label you this, and then this is the reason, and then here's the cure, and goodbye. No, that doesn't work. It really, again, it actually harms more patients. The third leading cause of unaliving is what? Medical errors. And the things that I hear, like, I'll give you an example. I had a patient come in who I've treated their family for years, and their aunt had a cognitive issue, right? She was getting dizzy, lightheaded, all kinds of stuff, right? And their solution to her, so they did a cardiac workup to make sure she didn't have a heart attack. They did a stroke workup to make sure, she didn't have that. They went through all that. They didn't do a cognitive workup at all, though. And what did they say? They said to her, oh, here's a walker. And these people still have their medical license. Here's a walker, keep the dizziness. Here's a walker. So in case, you feel dizzy and you're going to fall. Right. And so, right, exactly. And so that's the thing, is that no. So, and again, with unconscious bias, with confirmation bias, superiority bias, if the white tea doctors have not deconstructed their own inherent racism, they're not going to see us, they're not going to hear us. And it shows. Commonwealth Fund study, 52% subpar care across the United States, worse in the South. Why is that? Because the good old KKK, so the South, I mean, Tennessee's still fighting for their lives, trying to keep from Jim Crow 2.0. And so here's the thing, we cannot heal with our oppressor. I don't care what anyone says. I know everyone wants to hold hands and, oh, let's not be divided with hate. This is a life or death situation. Black maternal mortality rate 3 to 5 times more likely to unalive. Not to mention that they still use us as test subjects. Tuskegee happened in the 70s. Nuremberg was in the 40s. How on earth did they get around Nuremberg? Right? How did they get around Nuremberg in the 70s? They still tested on us. So the thing is that we cannot heal in an oppressive system. We can't heal in a, not to mention the fact our bodies were not made to process all this synthetic shit. It just, all this medicate. I have seen so much over medication because it doesn't work, because they don't treat our lifestyle. They don't treat our health. So what do? They're constantly giving us more, giving us more. I've had patients come in on 3 and 4 and 5 blood pressure medications, and their blood pressure is still sky high. Right? They weren't talked about their water. They didn't talk about their diet. They didn't talk about their stress level. They didn't talk about none of that. And so what happens, right? What happens? That patient is now literally a test dummy in the system. So this really doesn't work for us on so many different levels, because the system is flawed. When the medical system was exactly, and genetics only counts for less than 20%. The rest is environmentally driven, what we put the genes in, right? So making sure that the genetics just loads the gun, making sure we support those genetic SNPs, those polymorphisms, which are the defects in our genetic code. And again, if we have had intergenerational trauma, right? If we are Black, if we have Afro-Indigenous ancestry, guess what? We have intergenerational trauma that's been passed down that has impacted our DNA. Okay. And so again, we're already affected on a DNA level. And now we're put in a toxic environment where our air, our food, our water is also super toxic. So what happens? Bioaccumulation. This toxicity begins to build in our tissue. As it begins to build in our tissue and our bodies aren't able to release it properly, then what happens? Organ function begins to go down, and then eventually disease happens. What do they want to do? They wait until all of that happens, until we have a diagnosis. That's why we are driving chronic disease, not to mention all of the food deserts and the financial, sociological impacts. They're literally, the Black Wall Streets and the Tulsas. It's like anytime we try to get up, right, we get knocked down. And so again, it's about us taking back our health and taking back control of our own destiny. How do we do that? We do it through educating ourselves. We do it through learning how to heal. Hey, Omi, we do it through, doing practices such as holistic practices. And so in the beginning, it's all about exploring, right? But as you step into a professional sense, right, there is a different level of accountability and a different level of education that's required. And that's really my goal, is to standardize, in a sense, holistic medicine to the point where, we have a set language and we're able to actually replicate what we're trying to do with our health. Hello, Indigenous. Hello, Ecofusion. All right. So now let's jump into Eastern medicine. Okay, so Eastern medicine. So here's our Eastern medical practices. It's going to be like our acupuncture, right? Or our traditional Chinese medicine. That predates our Western medicine by over 10,000 years. They use what we call the meridian system. There's all these meridians, which are pretty much energetic lines that run through the system. Now, if we have had abuse or trauma, violence, or anything like that, those meridians are affected. And so what happens is that chi is disrupted, that energy balance is disrupted. As a response to that disruptive energy balance, it affects that related organ system, or even emotions, right? So in Eastern medicine, they talk a lot more about emotions. So let's say we have we've had abuses or things like that. Thank you for the follow. What happens with there is it impacts that meridian line. So it impacts, let's say, the liver. And so again, if we're holding on to anger, we're holding on to resentment, it's going to imbalance that chi. And then over time, now that organ system doesn't have the energy, the low frequency energy that it needs in order to heal itself. Okay. And so again, this is not physiological. This is not something that can be diagnosed and managed. However, it is something that can be tested. It can be, they assess it using your pulse rate, your tongue as well. They do pulse and tongue readings in Eastern medicine approaches. And so there are ways to measure it, but then, that's where you put either the acupressure or you put acupuncture needles, or even like moxibustion, where they do some burning of the moxa to open up that particular area. They'll do some infrared as well to open up that area, especially for detoxification. Also, too, emotional freedom technique or tapping is another technique, just for your emotions, to move those emotions out. Western medicine really rejects emotion. They really kind of gaslight us in a sense. They're not really paying attention to the effects of our emotions on, they try, right? They try a little bit. But again, this is so much deeper, than just our oh, we're having a bad day. If you have experienced continual oppression, a continual racism, continual just being beat down, you are going to again have to internalize it, because everybody wants us to play nice, right? So we have to gaslight ourselves in order to be able to just be in forced integration, and that really doesn't work. And so working on our emotional health, working on how we're doing. Exactly. And here, let me tell you about schizophrenia. So schizophrenia is in my family a lot. And what I learned in family constellation was that part of the schizophrenia is the mind and the spirit, because of the lost souls, right? Because many of our ancestors were lost through genocide, were lost through slavery and abuse and things like that. So they were not honored. They did not have their proper place in our family line, and so many of them displaced. So a lot of us in this experience, right, part of our soul is kind of floating with those individuals. It's a form of grief, actually, right? And so, but if you say that in the psychological realm, they're like, oh my God, because there's layers to this. Again, it's never one thing. So if we approached it from a reductionist perspective, if we approached it from, oh, this is just one thing, what's going to happen, right? That person now is just going to be on meds the rest of their life. They're not actually going to be able to fully transform and heal. I had a case many years ago of a lady who came to me. She had multiple diagnosis. Exactly, they multiple diagnosis. They had given her, schizophrenia, schizoaffective, manic, all the things, right? And as I worked with her, what actually came up was that her mother had passed away when she was around 2, and so part of her, soul kind of left with her, her mother, and so part of her was not even fully rooted here in this life, in this incarnation. Part of her soul was there with her mother. So as we began to, and I worked with her in the field and family constellation, and as we began to pull her back and she began to more embody into this life and process the grief, her neurological function began to improve, right? And so, yeah, exactly, Daphne. Yeah, F the DSM. I will not, I will not with this DSM. Like, don't even just, pass me with that. So, because well, number one, they most of the time they don't even acknowledge our trauma, right? Exactly. Most of the time they don't even acknowledge our trauma. They say, oh, that doesn't exist, all lives matter, and so how can we heal if our oppressor won't even acknowledge the oppression? We can't, right? And we can scream till we're blue in the face, and we can say this hurts, and we can say this is difficult, and we can say all these things. But guess what? If our oppressor, thank you for the follow, does not acknowledge that they are oppressing, and I mean, it is crazy work to me to hear people on these lives. I love political lives, my husband will tell you. And so I'll listen to them, and there are people that are like, well, colonization, that's just the American way. We just go in and take stuff from other people, not a big deal. Excuse me. Yeah, that is not. Hello, wait a second. This land is not yours. These, like, if I ran into a store and stole something, right? Oh, well, that's just the American way. I needed it. I saw it. You had it. I'm just gonna grab it. I would be arrested. They would arrest me. Like, that is not normal. Exactly. But the mental gymnastics and the justifications and the rationalizations, are insanity to me. Like, no, this is not healthy. No, this does not work. Yes, exactly. The DSM is for insurance companies. Exactly, Daphne. So is any of the diagnose and manage model, right? I had a discovery call yesterday with a gentleman who he'd been to every doctor under the sun. That's usually who I get anyway. And so he had said to me, he goes, well, yeah, I went to, my doctor, whatever. They told me kind of some stuff. They still didn't really know. But then when I looked at my medical chart, I had all these diagnoses on there. I said, you know why you had all these diagnoses on there? Because that's how they get paid. So they have to put these diagnoses on your medical record for your insurance company in order to get paid, right? And also, too, everybody check your medical records, please and thank you, because of that. Because guess what? Let's say you go try to get life insurance. They pull those medical records. If a doctor has put something on that record, right, they can deny you. And you didn't even know you had it. So, and especially the mental, emotional, psychosocial things, they love to deny people for that. So, definitely homework for y'all. Get your medical records, your most recent medical records, and check them. Always get your medical records. Always get a copy of them. Check what they're writing. Check what they're putting on there. You need to advocate for yourself, also for your elderly as well, your family, except exactly. All of your family and friends that may not be as savvy. Make sure you check those as well. I'm gonna have to plug my phone in. Hold on one second. All right, let's see. Yeah, make sure you check everybody's medical records, because if you don't and you have these things in there, you can be penalized for them. So definitely make sure that you have adequate information. Exactly, exactly, exactly. So, like this person said, you refused the vax, but they put it on there anyway. Again, they're going to CYA, right? And so you have to advocate for yourself, watch and pay attention, because they are only trained in a system, right? They are trained in a conventional medical model. They are trained a certain way. There is no getting around it. They can have the best intentions and the best heart and the best this and the best that, but they are still trained by a oppressive system. For me, when I was a little girl, 8 years old, and I learned about all the doctors because I knew I was going to be a doctor, I looked at I researched, I read, I love to read. So I read all of the different doctors. I read about Andrew Steele and osteopathy. I read about naturopathy and Benedict Lust. I read about Rockefeller and Carnegie and allopathic medicine. And when I read all of that, I said, oh no, I'm not doing that. Especially growing up as an Afro-Indigenous girl with my mother and everything. I said, no, I can't do this. I can't be a part of this oppressive system. Now, don't get me wrong. It was much harder for me because of that. But that's why I'm creating this standardization, creating this school, so we have structure. Hopefully the Department of Education will be around once we get to that point. But, the thing is we want to create a standardization in our medicine, right? We want this to be an HBCU, of course, because holistic medicine is ours, right? We just like TCM is coming from the Asians, and Chinese traditional theory, also too Ayurveda coming from India, right? We also have a medicine too that we passed down before we were colonized. You will be hard pressed to find one Black person on this planet who has not been trained in some level growing up in holistic medicine. This was all a part of our upbringing and all a part of our lifestyle. Oh, take castor oil for this. Oh, take this herb for that. Oh, take this tea for that. Oh, this tincture for that. Most of us have been taught some of that. We may not knew what it was called. We may not understood it. We may have resisted it on so many levels, but we understood it. Not to mention the fact we have a very unique spiritual relationship with our ancestors. We have a connection with our ancestors. We speak to our ancestors. That is why we are so resilient, and that is why we're still here. So these are not Western medical practices. These would be considered Eastern, although, Eastern Africa is in the East. So there we go. We have a reverence, right? And even when I got into family constellation and things like that. Family constellation was taken from the Zulus, right? From Africa. Most everything has been taken from Africa. And so we must reclaim ourselves. We must reclaim Africa. We must reclaim our medicine. This is ours. It is not everyone else's. So again, we're going to see all the colonizers. I've already seen it. I am forever on Mark Hyman's Mark Hyman's IG, because I'm connected to all these people, all these, YT male doctors, and you see them all the same. It's all the same conversations. It's all their faces. Oh, the food is hard. Oh, the food is toxic. Oh, we need to remove the poisons out of the food. Oh, we need to restrict the SNAP benefits so people can't drink soda. First of all, who put the poisons in the food to begin with? Can we talk about that? Can we talk about how the poisons got into the food? Because it wasn't us. It was not us poisoning the food. So I'm not going to now praise my oppressor for now removing the very source of poison that we've all been affected with. Just because they now realize their children are affected, their families are affected, now all of a sudden they're like, oh, wait a second, maybe we went too far. Let's back it up. No, 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 no. We need to come back to ourselves. We need to come back to growing our food. We need to come back to, using our herbs, using our practices, meditating, connecting with our ancestors. We need to get back to our original roots, and our original roots is holistic medicine. It's exactly, that is absolutely what their pattern has been. They create the problem and then they sell us the solution. I mean, just look at anything. They create the problem, sell us the solution. I will not clap for any YT male who is up there. No, absolutely not. I refuse. I will die on every hill about that, because as I began to deconstruct, as I began to become more conscious and came into who I am, I began to realize, wait a second, no, 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 no. This is not working. This hasn't been working. This will not work. And I'm not going to co-sign it, not one bit. So Eastern medicine really focuses on those energetic systems. It focuses also on the elements as well. So again, nature, right? So the metal and the wood and the earth, all of these things, we use nature in order to help us to determine what we need to do to heal. And so we have to get back to living more in sync with nature, right? That's another reason why I left the US, right? You cannot live in sync with nature. It's very difficult. Hey, Kushetik. Hey, Tanya. Very difficult to live in sync. I'm not saying it's not impossible, because it is. You can definitely buy land, and there are some amazing people that are doing that, and farming and all of those things. For me, I needed to be out of the colonizers' colonies. So because being in Virginia, you're on the plantation ground here. So definitely, yeah. And then also too, in Eastern medicine, we are very much, prevention focused. We are very much focused on making sure that the body has a system to be able to heal itself. And so again, and these are very nuanced systems. You have to be in tune. You have to be in sync. You have to be connected, right? I just don't see how certain lacks of melanin are able to connect, because again, we know that melanin has very much that nervous system connection. It very much has an electricity to it that allows us to be connected. Not to mention the fact that we have the Eve gene as well, especially as Black women. Check your genetics. We have it. That Eve gene, that's the original gene. So we are the originators. What is coming out of us, what is coming through us, is really us, right? And it's time for us to actually be able to receive the acknowledgement for the work that we're doing, number one, but also to be able to work on our people, not mammy, everyone else's people, but actually help heal our people. And so I will, again, die on that hill for sure. All right, here we go. Let's move to our next slide. Let me move this over. All right, and this just kind of reiterates what we were talking about with the terminology, right? So again, holistic, also natural. So in natural medicine, right? Anything that's natural, just because it's natural does not mean it's healthy for you. Okay. So be mindful. Anything that you put into the body is going to have to compete with what's going on. So you definitely want to make sure that the things that you are putting into the system are going to elevate you. So that's why I teach you therapeutic order. That's why I teach you organ system. So you can understand that connection, right? You can understand, because a little bit of something natural can be poison to the wrong individual. We talked about holistic versus natural versus functional. We'll talk more about it. And then we'll get into coaching versus consulting versus diagnosing. We'll also talk about alternative medicine versus complementary versus integrative. We'll talk about naturopathy, traditional naturopathy versus licensed NMD. We'll talk about scope of coaches, and then clarification again. The licensed naturopathic medical doctors do have legal scope. We definitely legislated against them quite a bit just to maintain our right to practice naturopathy. We are losing that fight, for good reason, for lack of organization on our part. And so, they can have it. They want to be under the AMA. They want to prescribe the rugs. They want to do all the things. Let them. I'm done with the fight on it. It's not it's not enough for me to want to keep going. I did it legislatively for years. It was crazy work. Lots of resistance, lots of, none of that. I'm done. I'm a holistic doctor. I'm good with that, which is why I don't really focus as much on the naturopathy anymore. It's all holistic, which again, 7 degrees. So I scoped all of it and I did all the education to be able to present that. um, let's see, traditional naturopaths do preserve natural practices. So traditional naturopaths like myself, we are trained in the natural ways to heal the body, and only the natural ways, even though we do have to take one pharmacology class. Pharmacology is not our jam. I'll leave that to the pharmacist. They can enjoy that. Although I do think it's funny the pharmacists are now trying to be natural doctors, which again, if you're an allopathic trained provider, you still have to go through actual training. You can't just tell people that you're doing something. If I did that, they would, have my hide. So, and then again, as a holistic doctor, we're trained in the mental, the emotional, the psychosocial, the spiritual, the environmental, the ancestral. We have a lot more distinctions and training, which I will teach you guys if you'll follow along with me, teach you all of these various modalities, because I wanted to make sure that I covered the gamut. And a lot of these things were shown to me, meaning that I had them in visions, like the pyramid that I go over, that goes over these aspects. It was all shown to me, right? And I then took that and go, okay, I'm supposed to teach this. I'm going to work with this. Teach me, teacher. So, I'm going to be able to get this information out to people so that they know the distinctions. Because patients really deserve clarity on what you're doing, right? And there's a lot of ambiguity right now with the health influencers, with the medical doctors. A lot of it is just money grabs, right? Oh, I'm trying to get a little bit of money over here. I'm trying to get a little money over here. I was never motivated by money. I love money. Money loves me, all that things. I've been very successful in my life. However, my main focus was making sure to keep the integrity of the work clear, making sure that I was truly not doing any harm unknowingly. Because again, in the beginning, you can have the best of intentions, but you can do harm without even realizing it. There's so many doctors out there who think, oh, I'm fine. Everything's good. I'm not doing anything that's, not, considered standard of care. But as I was working with people, I realized, wait a second, this could be harmful if done in the wrong order, or if done, without the patient's consent or without the patient's knowing, et cetera, et cetera, et cetera. So there's a fine line. And especially when we're working with patients that have such levels of trauma, you can really, hey, you can really again, inadvertently affect people's nervous system. I was so shocked, even when I was healing, thank you for the heart me, when I was healing from my own trauma, how much psychologists would re-traumatize me, right? Either they wouldn't show up to appointments, or they'd say some of the craziest things, or even at one point they wanted to study me because of the level of trauma that I had. So they have a camera on me, I'm over here losing my mind, or I would leave these sessions feeling 10 times worse than I felt during it. And I know that, yeah, sometimes that happens, but I realized, wait a second, even how they're approaching trauma is not going to work. My nervous system needed to be re-regulated. Hey, Melanin, it had to be re-regulated, and that's what got me into applied psychophysiology, which, if you're not familiar with the work of Nadine Burke, Dr. Nadine Burke, out of California, she used to be the Surgeon General of California. She actually spearheaded the study from Kaiser for adverse childhood experiences scoring, so ACE scoring. And so recognizing, yeah, when we've had these really traumatic childhood and traumatic experiences, we're going to have a higher propensity towards chronic disease. Oh no, you're good, baby. No, totally good. You're totally fine. All good. You know where to find the replays. And so just knowing, okay, when I've had all of these, if I've had, let's say, a parent that was incarcerated, or a parent with mental illness, or I was physically abused or mentally abused, or, SA'd, or any of these things, I'm going to have a greater propensity as an adult towards chronic disease, or towards unhealthy relationship patterns, or all kinds of things, and I have to work through that. And if I'm not provided a structure to do that, or if the provider is YT, or they've never been through these things, guess what? They are going to inadvertently re-traumatize me. And so again, there's so much nuance to this work. It's not just about one size fit all approach. Each individual human being must be treated as an individual human being, not as just a collection of symptoms or an ICD-10 code in for their insurance coverage. It's just not going to work. And I will die on that hill for sure, or I guess unalive on that hill. All right, here we go. Okay, so let's first talk about, all right, so holistic health and holistic medicine, all right, is all about that interconnected relationship. Okay, thank you for the roses. It's not just one aspect. It's how this aspect impacts this, which impacts this, which impacts this. So it's fairly complex, right? Because you're not just looking at it tunnel vision. Like in conventional medicine, they're only going to look at one thing, right? In our work, we have to look at how this affects this and this affects that, right? So if let's say I've been through trauma and it's unprocessed, that's going to impact my mental health, my mindset, which is going to impact my emotional health, which is going to impact my nervous system, which is going to affect my eating pattern, which is going to affect the toxic loads in my system, right? So I have to look at how these relationships all work together, right? Or not. Right. So very, very different. I remember when I was healing from my complex trauma and I went to a conventional doctor because my anxiety was just like, whoa, whoa, whoa. Because my brain, my executive functioning wasn't working at that time. And so I went and I'm like, well, he's just wanting to put me in an SSRI, of course. And I'm like, look, like I've done that before. I don't like how it makes me feel like I feel flat. He's like, well, that's the treatment. And I'm like, yeah, but there's got to be more. I said, I've got this genetic, and by that time I was a doctor. So I was a new doctor. I said, well, but there's this genetic piece, and then there's this mental piece, and then there's emotional piece, and then there's this physiological piece. I'm going to all this stuff. And he's like, that's too much. Like he dismissed me. And I had to negotiate with him. I said, okay, all right, fine. That's too much. I will figure it out, right? I'm going to do all the things. And so just give me something to manage this anxiety really quick as a symptom manager, and I'll figure out the rest. And I did, right? So I was on, anti-anxiety med for about a year and a half until I found neurofeedback, biofeedback, and started to retrain my brain, map my brain, etc. But again, my gut ecology had to be good. My diet had to be good in order for it to hold. And took me many, many years to get that, a lot of money. And so again, we really want to look at the body and the mind and the spirit. It was actually the Catholic Church who separated the mind from the body. Okay, the good old Catholics. So we want to bring these back together. You have a mind, you have an emotion, you have a physical body, and they all need to either be working together as a team in unison, or you're going to be scattered all over the place. And so I learned through my own healing process, Physician Heal Thyself, how to do that. And so again, the holistic medicine looks at the body and looks at the human, not just the physical body, but the spiritual, the mental, emotional, psychosocial, spiritual, all of those things. And you're going to be focused on how can I heal, right? Instead of what's wrong. If I can tell you, a million things wrong with me, right? I can break them all down, in alphabetical order, whatever. I don't need to focus on that. And that was also the world of psychology. It was the focus on what's wrong with the human condition. And that's all fine and good, whatever. We all have things to work on. But if my focus is more on the dis-ease and not on how I'm going to heal, I'm going to stay stuck in this disease. I'm going to make a great customer, but I'm definitely not going to be able to transform myself in terms of healing. So we also look at the relationships of lifestyle, environment, all different aspects of it. Natural health, a little different. It's going to focus. So this is going to be more of like your herbalist. I'm going to take a sip of my fancy coffee. That's all like settled at the bottom now. But now I know. So, hey, melanated. All right. So natural health, right? Natural healthcare is going to be more of like your herbalist, your herbal medicine, your plant-based therapies, going to be looking at your food as medicine, it's minimally processed ingredients. But again, just because it's natural, right? So I saw somebody post something about chemotherapy, right? Okay, so if you're, like, say, on a chemotherapy drug and you've got symptoms from the chemotherapy, you can't use a natural herb because it will interact with the chemotherapy. It'll make the chemotherapy less effective, and that's with most synthetics. So synthetics, and so they originally generated synthetics from naturally occurring substances. They just combine them with binders and fillers in order to patent them to make rugs, right? And so, like, for instance, St. John's wort, like, you can't take St. John's wort with, a lot of the SSRIs. Why? Because they do the same thing. They have the same, what we call, mechanism of action, right? A mechanism of action is what makes a natural or synthetic substance work, right, in the body. Mechanisms of action. So if I am trying to heal my body, right, I need to be mindful of what I'm putting in. Again, just because it's natural doesn't mean that it's healthy. That's why we follow therapeutic order. So therapeutic order, how the body actually is designed to heal. So in your mind, majority of the immune system, hormonal system, neurological system is all housed where? In your digestive tract. So what are you going to do? You're going to heal your digestive tract. How are you going to heal your digestive tract? From the top down. What you're eating, what you're putting, how your mouth pH levels are, your stomach acid, hydrochloric acid, etc. Your liver, how you're metabolizing, your phase 1, phase 2, phase 3, how you're metabolizing there, how you're absorbing in your small intestines, because that can be affected, any infections that are in there, and then how you're eliminating waste out through your kidneys as a phase 3, or your large intestine. So that's how you're thinking of healing the body. It's in therapeutic order. That way you're tapping into the body's own wisdom and own ability, and you're not just replacing a pharmaceutical for an herbal. People take way too many things, way too many supplements, way too many herbs, and they think that they're doing something good. And I'm not saying you're not, but again, this is medicine, right? Herbs are very powerful, right? Very, very powerful. So if you're just grabbing something off the shelf, oh, I'm taking this, I'm taking that, I'm taking this, I'm taking that, you have no idea the mechanisms of action, that you're doing. And so making sure you really think about what you're doing before you're doing it. That's why we start in therapeutic order with your foundational health. What's your foundational health? Your water, your food, your sleep, your movement, the basic foundational health things that are then going to support your body's ability to heal. And then you start adding the things, right? Why do we do that? Because sometimes just you would be shocked at how many symptoms are just from dehydration alone. I mean, you can have heart palpitations. I've had patients have heart palpitations. I once had this guy, older gentleman in his 80s. Every time, oh my gosh, he would go, Dr. Steele, I have heart palpitation. I'm having a heart attack. No, sir, you're not having a heart attack. How much water have you drank? Well, no, 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 I'm having a heart attack. And the reason I'd say no was because he had done this like 4 or 5 times. And so I'd have to calm him down, and I'd have to be like, no, really, how many bottles of water have you drank? And he's like, one. I said, okay, well, do me a favor, make sure you drink the 5 bottles of water that you're supposed to do every single day, and then call me back. Okay, so call me back. And then sure enough, after a few days, he'd call me back. He'd be like, you're the best doctor, Dr. Steele. Thank you so much. And I mean, literally, we would go through this all, and I'd say, hello. It just wouldn't stick. So again, you could have symptoms just from your foundational health. That's why in this class, we do that nutritional assessment questionnaire with all of those symptoms, because you don't realize how many symptoms are from just not getting proper nutrition. And when they have literally, like, I'm not a conspiracy theorist, but literally, when they have poisoned our food, pulled all the minerals out, pulled all this stuff out, guess what? Our nutrients, we're not getting our nutrients. So even if you're eating 100% healthy diet, you may not be breaking it down. You may not be digesting it. You may not be assimilating it properly. And so because of that, what happens, right? Your body's going to accumulate toxins. Those toxins are going to create all kinds of different symptoms in the body. So that's why we follow this therapeutic order. again, I came up with a lot of this stuff because of our training. So in functional medicine, we're trained to run every lab underneath the sun in the beginning. So I did that. And thank God for those original patients, because Lord, they trusted me and they were spending thousands, because at the time it was just really expensive. And so, you know, they would run all these tests, and then every test would have treatment plans, and then they'd be on all these supplements. And then I'm like, wait a second, this isn't gonna work. Like number one, like all these different things are doing all kinds of different things. What can I do to be able to put this in order? And that's when I started really going, okay, you know what? Digestion top down, what they're eating, digest. And people will come in wanting to be reactive, wanting to, oh, what herb do I take? What supplement do I take? What diet do I do? And I have to slow them down and go, okay, let's get these foundational health pieces first. Your water, your food, your sleep, all these, your movement. Let's get all these things addressed and stabilized first before we get into that stuff, right? So I cannot stress this enough, because if you try to do that, you're doing nothing more than conventional doctors. All you're doing is just, again, replacing your pharma for natural things, and you're just throwing a whole bunch of stuff. Again, moneymaker for a lot of people, just throwing supplements at the problem, or herbs at the problem, but you're not actually healing. And again, I wanted to actually help people heal. I wanted patients to actually get well, to learn life skills. And over this time, it's been amazing, because after years, people will come back and they'll be like, oh my God, Dr. Steele, I'm doing so much better. Da, da, da. And so being able to transform people's lives, let me tell you, that is better than any dollar amount I could possibly get, to be able to, have helped babies be born in this world, help people get married, help people heal from chronic disease. Like, you have no idea, like, how just rewarding that is. So if you're on this, class, you definitely have a calling. Of course, you want to either heal yourself, heal your community, heal others. And so let me tell you, do it in an ethical way. The money will always come. The money will always come. It will always come. But your ethics, that is why I've been in this field for 20 plus years, and I haven't been, and trust me, been up against so much resistance. But guess what? That medicine, they can't touch the healthcare. They can attack me personally. They can do this, they can do that. But when you get results with people, that lasts a lifetime. All right, cool. Now let's look at functional medicine, because they're doing some funky stuff in that. So functional medicine, some of the things you really have to pay attention to, there are a lot of doctors who are not trained in this. So if you go to a functional doctor, ask them where they went to school, what training they've had, because I'm seeing so many of these medical doctors and conventional doctors get no training, and instead they hang their shingle as a functional doctor, and you think you're going to them because it's a big money maker. All that lab testing is not covered under insurance most of the time. Patients are spending thousands of dollars and they're not getting the results. Food allergy testing, for instance, a big waste of money. I don't care what you say, right? That's why I teach you guys how to pulse test yourself. So you don't need to go and spend $500, $400, $800 in all of this unnecessary lab testing. And that's why I start you off with teaching you at home lab testing, your salivary pH. You can learn a lot just from testing your salivary pH and your urinary pH. You don't need to do all these other things. And that basic blood lab panel that's covered under insurance, I can get so much information out of that, right? If you know what you're looking for. So again, there's a science to it and then there's an art to it. But a lot of people, I spent years learning this stuff because I wanted to be on mastery level. I know saying master is a lot for me, but I didn't just want to do it a little bit, right? I wanted to really understand exactly what I was doing with patients, and I followed patterns, and I noticed, and I trained with some of the most amazing docs who, also too, had good education for me, and I learned and I picked things up. And so again, be very mindful, because there's a lot of money to be made in this space. And so if you have going to a functional doctor and they want to give you thousands of dollars worth of testing, definitely that's something to pay attention to. Functional medicine is great because it's a systems approach. So it does give you that objective analysis. However, you have to know what you're looking for. And again, there's an art to it as well as a science. And so understanding
what tests to run, how to read them, how to evaluate, how to treat off of them. Really, really important. I typically will start off with that basic lab panel, your CMP14, which is kidney liver function, CBC with differential, which is your expanded immune system, TSH, which is anterior pituitary to thyroid. Then I'll look at homocysteine, which is your body's detox ability. I'll look at vitamin B6, B12, folate, and mag. That shows me how you methylate, meaning how you process your proteins, but also show me a lot of things going on with your detoxification, your liver, etc., because those nutrients are required for those things. So I can get a lot of data off of a lab test that your insurance is going to cover, right? So why am I going to have a patient spend thousands of dollars in a lab when their diet is not good, they're not sleeping well, they're not drinking enough water? That doesn't make sense to me. So I'm going to use that basic test, right? And I'm going to teach them how to get their system stabilized. And then if we get stuck, I can always go reach for the test. From that moment, then I'm going to use your organic acids profile, which is first urine collection of the day. It looks at the small intestines. It looks at the absorption. Organic acids, amazing test, about $400 or $500. Going to look at digestion, assimilation, how you're breaking down your proteins, your fats, your carbs. Looks at your small intestines, which is your Krebs cycle. It's going to look at all of your absorption and how your body's actually metabolizing. It's going to also look at detoxification, your oxidative phosphorylation, how your body is detoxing. It's going to look at key nutrients like CoQ10, magnesium. It also looks at heavy metal issues. It's going to look at antioxidants. It even looks at bacteria, can pull mold exposures as well, and also your neurotransmitters, because all of those are made within the small intestine. So $400 or $500 test, that would be my second route to go to when I'm looking at it, because again, I'm treating the system, I'm not treating a diagnosis. So, and I know that majority of the immune system, hormonal system, and neurological system is housed in the gut. So why am I going to go do a hormone test, right, when the gut is not working well? If there's infections in the GI system, if there's mold, which is a neurotoxin, which is also an endocrine disruptor, if there's mold in the system, why am I going to run a hormone test? Even though people want, oh, I know my hormones are off. Your hormones are a symptom. The neurological system is a symptom. The immune system is a symptom. If you're in an autoimmune state, it's a symptom. So again, we have those tests that we can run. But again, most patients, hey, Bubba, most patients, that basic blood panel is probably at 80% of my patients. I can treat based off that. Then secondary, we run that organic acids test, about $400 or $500, right? Again, you're saving patients a ton of money. Also, too, we look at the order of operations. So again, don't let these doctors fool you. Do not let these doctors have you running thousands of dollars worth of tests, running here, running there, because guess what? Every test is going to have a treatment. So now you run a test, and then now all of a sudden there's thousands of dollars worth of supplements. If you are treating, oh, now I've got a viral infection I'm treating, I've got a yeast infection I'm treating, oh, I've got nutrient deficiencies I'm treating, oh, now I'm treating, the body cannot handle all of that. I've seen too many patients come in and they are on a litany of supplements, all doing what? Different mechanisms of action. Remember that term, mechanisms of action. They're all doing different things. Again, the body is organized. It's efficient. Nature is not confusing. So why am I going to throw all kinds of things at the body for the body to deal with? That's not going to make sense. So again, be very mindful, because this is a very predatory space right now, meaning that there's a lot of doctors out there who are hanging their shingle thinking that they're going to make a whole bunch of money. And who are they going to make a whole bunch of money off of? You, as a patient who is not aware, who is not trained. So definitely, I get it. We don't guess, we test. But again, if you're not dealing with your nutrition, they'll skip over the nutrition. They'll put you on some impossible diet, right? Not realizing the mental and the emotional component of it. They'll try to put you on some impossible diet, run all thousands of dollars worth of lab tests, and give you hundreds of thousands of dollars worth of supplements. And then you still don't feel better afterwards. I've seen it a million times. I get people's patients after they have been through, after they've run through a million of these doctors. So definitely be mindful, because it's gonna ramp up even more, especially because RFK Jr., who got him in office, was health influencers, right? It was Food Babe. It was all those people. Those were the people who got him into office, who supported him and backed him. Okay. So they stand to make a whole lot of money with him going up there talking. Now all of a sudden, like everybody, like for instance, Lyme disease, right? Okay. here's my little, I swear I'll get off the soapbox. But here's the thing. When a patient comes to me and they're like, oh, I have Lyme disease, I know that they've, not to say that Lyme disease is not real, because it's real. But again, these things have to live in an environment, right? Parasites will only live in an environment, right? So viruses, if you've been exposed to a virus, your body's going to produce antibodies. We can we can lower the viral load in the body, but you cannot get rid of a virus once the body has been exposed to a virus. You can only now support the body's immune systems to keep that viral load low. Okay. So again, there's a lot of predatory behavior in this space. And so you really need to be educated. This is why I like to do this work, is to educate people so they are not, scammed. They're not, because unfortunately the healthcare system is broken. It's not working for people. And then what happens is they'll go to natural providers in desperation, and then they'll get taken advantage of. And then unfortunately, and thousands of dollars later, and they're still not feeling better. And what does that do? Betrayal trauma, institutional trauma, iatrogenics, and then eventually they end up in my office, and then I'm having to do a miracle, for $20. So it's not going to work that way. So I'm going to educate you now. Educate your friends, talk to your family, make sure that they are also not victims to this. All right. Integrative medicine, again, it combines your conventional practice. So a lot of conventional doctors are trained in integrative medicine. It's an evidence-based approach as well. But again, they're using, you have to be trained in the conventional practices on top of your natural practices to integrate. That's what it is, integrative medicine. So I'm integrating into, the current systems that be. So definitely make sure that you understand the distinctions with that. That allows me to say, okay, I'm looking at things. There's, arrhythmias. Well, arrhythmias is not really a thing, but let's say there's some, we'll just go with arrhythmia. There's some arrhythmias. Let's make sure that there's not any, underlying cardiac. Let's make sure that the heart, the structure of the heart is where it needs to be. Let's say if a patient wants to come off of their blood pressure medications and they've been on them for a while, we want to make sure that the structure of the heart is stable, right? So I'm going to leverage a cardiologist for that. I'm going to send to a cardiologist. I'm going to work with them, and they're going to do, their cardiac workup to make sure, right? Why? Because they are a specialist in that particular area. We're not specialists. We're specialists in holistic medicine, right? And so people refer to us, but we're not necessarily specialists in one organ system. So there is advantages to being a specialist in one organ system. If you develop something, that's aggressive, right? Like a tumor or something like that, you need to have a kind of a watchdog on that particular disease process. That's why we try to teach people prevention, right? Just because you don't have symptoms doesn't mean the body is healthy. Health is a state that has to be created over time, right? And so you have to work on your health every single day. How much water are you drinking? How much protein are you taking in? How much movement are you doing? How is your stress level? Your nutrient deficiencies. Are you detoxifying your organs, twice a year? So there are a lot of different things that need to happen when it comes to health. Unfortunately, people are not properly educated about their health. They're only educated in disease and disease models. So they go to their conventional doctor says everything's fine, and they assume everything's fine. Your conventional doctor, when they say that everything's fine, they mean that there's no disease to diagnose. They don't understand your health. They're not trained in your health. They're not trained in nutrition. They're not trained in organ function. They're not trained in toxicity. They're not trained in what supplements to take, what herbs to take. They're not trained in that. So stop going to an electrician looking for a mechanic. Okay, you keep going to an electrician looking for a mechanic, and then you're frustrated that the electrician is not being the mechanic, right? And that may require a little bit of investment on your part, because for me, I don't participate in the insurance-based model. Yes, I will run labs under your insurance, but your care, I'm not going to play those games with the insurance companies, right? I'm just not going to do it. So you may have to come out of your pocket a little bit and invest, right? I don't charge patients a lot of money, but there are some providers, again, you may have to go to that one provider. You want to go to that one provider. They may be a $200 consult, a $300 consult. but that information may save you, a lot of money over time. You got to think about the long-term commitment. There's no flash sales on cancer. There's no diabetes, buy one, get one free. There's none of that. And in fact, now that, the tariffs are tariffing, they want also tariff medication as well. So if you're on these synthetic medications and it's one of those that we import, or we import the raw materials to be able to create that, now all of a sudden pricing structure is going to go up. But not even just that, even the idea of it can spark excitement in some of these corporations where they're like, oh, a tariff, let me go and charge more money for that, even if their bottom line is still the same. So really, dependency on anything external, supplements included, you've got to learn how to live independently of not having to take so many things, right? Again, there's baseline things that we can do foundationally that help you to heal, working on your health and building that as a foundation rather than just running around and managing disease process. So also too, when you're working with your integrative provider, they should work in collaboration, meaning that they will send medical records to and fro. And so there's communication back and forth. You don't want to silo your providers. They do so much of that in conventional medicine. And I've seen a mess of it. I've seen so many times where this person is prescribing this, and this person is prescribing that, and this person is prescribing this, and this person is prescribing that, and nobody's talking to each other. Well, you're the patient, okay? So if you're taking this and this and this and that, right, and it's interacting, now you're causing harm to yourself, not even realizing it. Hold on one second. Yay! I have my little affirmation set up, so it goes off at different times. So it's 1:11, so it goes off. I'm like, yay! Okay, so anywho. So we don't want to silo our providers. We want to make sure our providers are talking to each other. Providers a lot of times don't like to talk to each other. I remember early on in my practice, I was so excited, like I think my first year, and I would call the providers. So I'd send the medical records release form and I call them, and they'd be like, why are you calling me? Why are you bothering me? Like, hey, 100 packs. So I'd be like, because because we're co-treating, and so again, they're not trained to work collaboratively. So you're going to have to force that interaction, and make sure that you get copies of everything, you bring everything. I think some of my most amazing patients would come in literally with binders of things, listed out. Oh, thank you so much. Thank you. And so they would come with like binders of things because they would keep things organized. If you don't advocate for yourself and you don't keep yourself organized, forget it. Don't assume. They have thousands of patients they have to see. The insurance companies, they're really owned by the insurance companies or whatever administration that they're working for. So they are boom, 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 boom. Most of the time, they don't have time to look at your chart. They're walking in a room blind. They talk to you real quick, boom, 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 boom. And they're dependent upon you to tell them information. Have you ever went, ask your doctor if this is right for you? Shouldn't my doctor be knowing if this is right for me? You know what I'm saying? So we know that this is a big cash cow for people. And again, your health is at risk. And so we want to make sure that you are staying informed, you're staying educated, you're advocating for yourself, and especially for your elderly patients and your kiddos, because those are the most vulnerable in the population. The older people, man, they see those babies coming. I've seen them come in 13, 14, 15 different medications, all doing different things, all interacting, all, and the liver can't process it, the kidneys can't process it, and they're getting more and more sicker and sicker and sicker over time. Also, don't let them just slap a diagnosis on you really quick without doing due diligence. Again, that's a labeling system. Get a copy of your medical records, read through those medical records, challenge those things, fire your doctor, get a new one, go around, literally interview, tell them on the first appointment, I'm interviewing you, and so a good doctor, they won't feel threatened by it. So I'm not threatened as long as I'm not disrespected, right? If you disrespect me, that's a whole nother thing. But, as long as we're collaborating, we're good to go. We're like Daphne said, we're Gucci. So, the thing is, we want to make sure that we are paying attention to what's going on with our health and our health care, especially if you are a Black, brown, or Indigenous human being. All right, let's see.
Let's go along. Where are we at? Let's see. This one keep me straight. Oh, you know what? Oh, yeah, this is good. All right, coaching, consulting. Okay, so let's look at the difference between coaching, consulting, and diagnosing. All right, here we go. So coaching, right? You're asking those questions, you're listening behavioral change, you're providing accountability, but you're not diagnosing anything. You're not telling somebody what's wrong. You're not saying, oh, you got this, and this, and you need this, and this. No, you're guiding a person through their own transformation, their own healing. You're acting as a container. You're motivating, inspire them. You're helping them to get to the next thing. You're giving them options. You're giving them possibility, but you're in no way telling them this is what's going on. That's what you have to do for it. There's no, exacting, right? Because again, a lot of times in a coaching structure, you don't have the data. Now, if you if you train through me, I teach you the data, because that is one of my pet peeves is we've got a coaches, I won't name any programs, but you've got a lot of health coaches out here who are just trained in a whole bunch of diets. They're not actually trained in any objective analysis or subjective analysis. They're literally just trained to give you a whole bunch of diets and give you some supplements and call it a day. And there's no science in it. And that was one thing that just burned me up. And so even in a scientific coaching perspective, you're giving them the data, you're giving them the information, you're showing them the information, they're taking their own pH levels, and then you're saying, oh, if the pH levels are this, you need to add this. If the pH levels are that, you could add that, right? You're giving them those options, you're giving them the education. It's really coming from a public health education perspective. You're not diagnosing, managing, you're not saying you're curing things, you're not chasing after bugs, you're not saying, oh, I found this bug, now here, treat it. I've seen a very prominent, he's not formally trained, but he says he is. Anyway, so you can tell because he doesn't have clinical structure. And so he chases after these bugs and is going, oh, here's this bug. And then wants to sell you a whole bunch of herbs and supplements for it. And again, that is a problem because that is technically diagnosing and managing. Technically, that person can get in trouble for practicing medicine without a license. So you definitely want to be careful. Consulting is where you're sharing your expertise. So I do a lot of consulting with conventional doctors, but also with companies, with corporations, teaching them, how they want to break through into the holistic market, or, they want education about labs and lab companies, or they want education about supplements, etc. I'm giving my expertise in whatever field that I have, right? And so whatever education that I have, I'm bringing that to the party and being able to offer it from my own experience, right? So I'm not telling people, oh, this and that, and this is finite. I'm saying, no, from my experience, over testing doesn't work. Over testing is really ineffective, and this is why, etc. And so as a consultant, you're using your expertise and your education to, again, support people as they're trying to learn. So coaching, typically you're going to work with the individual. Consulting, you're typically going to work higher level. You're going to work more with institutions, companies, etc. Like if you want to get into corporate wellness and things like that, you're going to come in as a consultant to help a mass of people, right? Even if let's say you want to be a speaker, or you want to run retreats or things like that, you're going to be more of a consultant. You're not necessarily going to be a coach, right? So just understand the distinction of it. Now, you actually have to have experience. So I would start off as a coach, start getting the experience, right? So again, over 40,000 patients. I started off working with patients individually before I became a consultant, because I wanted to actually have data to be able to go off of. So again, in the order of operations, you're going to start off as that coach, working one-on-one. You may even work group, etc. And then eventually you can build into a consultant, because now you've learned a lot more about the field and information. So you still have to stay within your scope of practice. You provide a lot of education, and then also to protocol. Like for instance, I explained to you, hey, I'm going to do, just that basic lab panel to begin with. And then from there, hey, Black Cabinet, I'm going to do the kind of initial lab work, and then I'm going to do an oat panel.
I know that because of the education, the experience that I've had from years and years and years of working with people, right? Of realizing, wait a second, I don't need to run these thousands of dollars worth of labs on these patients. In fact, if I just run this basic lab panel, work with patients on their foundational health, that's going to get 80% of these cases better, right? And then I can save them money, right? And then eventually, hey, I may need to pull in this, more expensive test to be able to help them determine. That comes after experience and working with people, and making a lot of mistakes. Quite honestly, you're going to learn mostly from your mistakes. All right, so medical diagnosing, again, requires a license. So I never want to catch any of y'all going, oh, I treat XYZ condition. Oh, I'm a diabetes expert. I'm a perimenopause expert. No, you're not, right? You are treating these humans, right? You are not working with these diseases, right? Leave the diseases to the medical doctors. They can go find all the bugs. I remember you're working with pathologists. I'm like, oh my God. And people love it and they're into that and they love with their microscopes and they love going out. That's great, right? That is not me. Hopefully that's not you. Because again, for me, I want efficiency. I want the path of least resistance. How do I develop the path of least resistance? How do I gain that? I gain that through working on the environment, because that environment has to be conducive, right? Meaning that environment has to be one that allows for these things to flourish, that allows for these things to be there. I've got my laptop is about to go. Hold on a second. I'm going to have to move my setup. We talk so much that our batteries are going. Look at our batteries. All right. All right, groovy tunes. Let me move this around. I need a camera crew. All right, groovy. Let me pop this up. All right, there we go. That should be pretty good. Let me close that. All right, groovy. Okay, here we go. So again, when you're diagnosing, what you're doing is you're looking at make sure that doesn't. There we go. Okay. So when you're diagnosing something, right, again, you are trained in that, right? You're trained. And that's why conventional doctors go through residency, right? So they go through their original, 4-year bachelor's like we do. Then they go through their 4-year doctoral, right? Like we do. And then they go through residency. Hey, third man, depending on what their specialty is. The purpose of that residency, that's why the naturopathic medical doctors don't do that. And that's why I'm like, how can you, the reason they go through the residency is to gain experience to identify these pathologies so that they can understand, that they can see the difference in labeling eczema versus psoriasis, or labeling a cognitive issue based off of a cardiovascular one, right? So the more that experience that patient has had, or excuse me, that provider has had, the more exposures that provider has had, the more they're going to learn. So we're going to have a real issue in the next few years, because the states that have restricted women's health care, those programs are not going to now include that particular procedure, or even understanding all this. So what's going to happen, unfortunately, is more women's health is going to be at risk, right? Also, they pulled all of the data. So in public health now, we don't know maternal mortality rates in Texas. We're not going to know the mortality rates in Georgia, because they pulled that public health information. So thank you very much. And so again, this is dangerous when you're not having that exposure, when you don't know what to identify. Oh, these signs and symptoms are specific to this. These signs and symptoms are specific to that. So without that particular residency residency where you're actually learning those pathologies, you are not trained and equipped to diagnose and manage anything, right? So again, these licensed naturopathic medical doctors running around pretending like they're medical doctors is very dangerous, because they don't have their, number one, disease is not their focus, and number two, they don't get the experience of residencies where they're seeing these things over and over and over again. I know they're trying to do that, but again, these are two totally, health is very different than disease. The structure behind building your health, very, very different behind the structure of diagnosing and managing a disease. Diagnosing, again, requires that labeling, requires understanding which tests to run, how to interpret those results, what standards of care are available, what treatment options are available. And also, too, there's a legal responsibility to that. So please do not get caught trying to diagnose. A lot of times, people that are not formally trained, they will do this type of practice because they're not aware, right? Because they're not formally trained in these different systems, which is why, again, I wanted to build my school, because I'm like, people need proper training. This is not going to work. So let me go to our next slide. And we're buzzing along here. We got about another probably 20 minutes. Oh, wait, I think I already, no, we kind of talked about this already. All right, let's kind of get into alternative medicine for a minute. So alternative medicine is the least scientific of all. So I have a bachelor's degree specifically in alternative medicine. Alternative is just an alternative to. So for instance, that would be like, oh, this patient's coming to me with a diagnosis, right? I don't need patients to come to me with the diagnosis, but a lot of times people do. And so I already have a diagnosis, and now let's say I have hypertension, right? So instead of taking the, beta blocker or the calcium channel blocker, now I'm going to look up in my herb book, cayenne or beets or hawthorn berries, and now I'm just going to give that patient that and see what happens. There's not a whole lot of science to that. It's literally just guessing. So there's meaning that there's nothing to measure if it's going to be successful or not. You're not taking, now maybe if I was taking the blood pressure, and then maybe if I was taking nitric oxide levels, and then I wanted to add beets to raise the arginine, maybe that's a little bit more scientific. But traditionally, people that practice alternative medicine don't do any of that. They literally are just looking things up and giving I heard that this was good for that. Oh, I heard this was good for that. Oh, take this for that. Oh, take that for that. And so again, that lacks science. So you're literally just replacing a pharmaceutical for a nutraceutical. So you don't know if it's going to work. You don't know when it's working. You don't know proper dosing. And again, you're just keeping patients dependent upon things that they may or may not need. Complementary medicine is a little bit different, where you're working alongside conventional practice. So I did this a lot with oncology. So let's say, the patient is going through like an active chemo or radiation or surgery or something like that, right? So the conventional doctor, again, they're focused on the disease. I'm focused on the health. So the conventional doctor is not going to focus on the patient's nutrition. In fact, they're going to just be like, oh, eat whatever. And in fact, a lot of times in the chemotherapy centers, they're handing out ice cream. Like, so I work with the patient on making sure they maintain their weight, making sure that their nutrients, making sure there's no interactions, making sure that their mental and emotional state is in order, making sure they're communicating and expressing, because patients, when they don't express and communicate and they continue to internalize, it affects those organ systems, and then over time can develop into dis-ease. So complementary is, I know what's going on over here because I'm speaking with these conventional doctors, and then in kind, I'm working alongside. So I'm not negating what they're doing, but I'm making sure that I'm catching the things that the conventional doctor is not actually doing. So that is complementary medicine when we're working alongside. And then we've talked about integrative medicine kind of at nauseum, but wanting to understand that this is patient-centered model and it's collaborating. So the patient is the center. So even when I've done like end-of-life care and I've gone into hospitals and things like that, because the conventional doctors are like, oh, we don't have anything else to do. And so kind of going in and having to, create those sacred spaces to be able to facilitate, that end of life care. Again, I'm working collaboratively. It's the patient, what the patient wants. Does the patient want a DNR? Do they want a DNR? Where's the patient mentally, emotionally, spiritually? Are they ready to leave? How's the family? Has the family processed things? So again, integratively working alongside conventional. They may or may not have different methodologies that they need to do, but I'm working and focused on the patient, advocating for the patient, slowing things down, explaining things to the patient that maybe their conventional doctor missed or wasn't able to explain because of time, etc. In a lot of cases, as an integrative provider, you are literally the best friend to the conventional provider, because you take the mental and emotional stress off of them because they don't have to do as much with the patient. But also too, you're able to be that voice, and you're able to ask questions that the patient wouldn't know. So instead of, oh, just taking everything as gospel, you go, oh, wait a second, what's, because proper medical terminology, so you go, oh, what's the prognosis here? And what are the benefit or risks of that treatment here? You're able to pretty much be that advocate for that patient, so that the patient isn't just ran through the medical system. So that's some of the additional distinctions between integrative medicine as we work. All right. And then we began to talk about this, but let's kind of drive it home. So naturopathy is based off of it's like 5 or 6 principles, like the prevention is worth a pound of cure, doctor is teacher, we only use natural things, first do no harm. There's a couple other ones, is why I can't think of them off the top of my head, but it's really based off of the whole person and treating the whole person. But it does not go into the mental and the emotional, the psychosocial, spiritual aspect. That's holistic medicine. Naturopathy is primarily focused on the mental, on the physical aspects of the body, but treating the patient as a whole. So there is a little bit of mind, body, spirit work, but definitely not to the extent that we go through in holistic medicine. So there's also certifications you can take, like weekend certifications in naturopathy, to understand that kind of just the theory behind it. It's not enough to be able to practice naturopathy, but it's enough to understand the theories behind it, because there are distinct theories that we utilize when we're working with patients in the naturopathy model. I am a traditional naturopath. I have had standardized training. So when it says no standardized training, it means that, like, all of our programs are different. So I went to the University of Natural Medicine because Dr. Mark Smith is an MD as well, and did a lot of work in functional medicine field. And so I wanted to get a lot more into the laboratory diagnostics. And so, like, for instance, one of my professors was Dr. Lawrence Wilson, who he developed the hair mineral analysis testing. He literally wrote the book on it. And so that was one of my professors, is trying to understand, how to use all of these different laboratories to be able to determine causative and then be able to treat based off of it. Not every school is like that. Some traditional naturopathy schools will just teach diets, will just teach herbs, will just teach supplements, will just treat iridology or homeopathy, etc. And so I wanted to focus on homeopathy and also laboratory diagnostics. So unfortunately, we don't have standardized training in naturopathy, especially in traditional naturopathy, which is kind of where this naturopathic medical doctor kind of came in, because they wanted standardized training. The only problem is that their standardized training, they want to also they want to pretty much colonize naturopathy. They want us gone. They don't want us practicing anymore because we cut into their profit margins. They want to be under the American Medical Association because they want to be considered primary care doctors. And so they have created pretty much oppressive systems of education. And then also they diagnose and manage. And that's not what we do. So I work with, gosh, what is her name? Some of these people I can't even, Victoria, Dr. Victoria. So Dr. Victoria owns a naturopathy school in the DC area, and she trains, NMDs, naturopathic medical doctors, when they come in. Mind you, their diplomas say naturopathic medical doctors. Ours say naturopathic doctor, but they want to get rid of us so they can take over our legislation. They're pretty diabolical, actually. And so she, we've talked kind of extensively in the education space, and she says they'll come in and they don't know. They're literally, because they're trained in this hybrid diagnose and manage model, they're not trained in the nuance of the body. So in traditional naturopathy, we're still trained in things like being able to read the skin, or being able to read the tongue, or being able to assess the body from more of natural reference points, not just those more medicalized things. So they're definitely more trained in the medical side of things and less trained in the traditional naturopathy. And over time, they're just kind of eroding those natural practices, unfortunately, sadly, because again, they want to be under the AMA. If they get their wish and they're completely under the AMA, then the AMA, of course, is going to require them to remove all their natural practices. Don't believe me? Look at the osteopaths. So osteopathic medicine, Dr. Andrew Steele, again, very natural in its approach, right? It kind of mixes, internal med along with chiropractic, and kind of creates osteopathic practice. And so when the osteopaths went under the AMA, they were asked to remove their holistic practices, and now they're whitewashed into more of this conventional model. So again, they think that there's going to be some gold at the end of the tunnel of insurance billing, I guess, not to realize that unfortunately it's just going to be much of the same. So again, in the licensed medical naturopathic doctors, they're the ones that own the 5 schools like Steele and Southwest and Bridgeport and all of these things. And so when I knew I was going to be a naturopath, I went to their conferences to be able to see if this was going to be a good fit. And the vibe just was not there. One of the presidents made some statement about my hair, and as soon as they make statements about my hair, I'm like, we're out. So definitely, check it out for yourself. I know a lot of people want to get into naturopathy. They look at it and they don't realize the history behind naturopathy and how they actually tried to unalive Dr. Benedict Lust, who brought naturopathy from Germany into the United States. They try to unalive him, take it from him. There's a lot of different things, unfortunately, in the naturopathic world. So if you're really interested in being a true naturopath, a pure naturopath, then traditional naturopathy is going to be more of your fit, not necessarily the large naturopathy schools. But unfortunately, they are colonizing it to the point that they're trying to snuff us out of the world. So just so you understand the distinctions with that. All right. Let's see. And then my beautiful holistic medicine. So holistic medicine. Hey, Sajas. So holistic medicine, we look at all different aspects of the patient. So we begin on the physical realm. We look at those foundational health, the water, the food, those sorts of things. We look at those aspects of it, but then we also look at the environment, how toxicity, but also how our relationships impacted, how our physical environment also impact ourselves. So we look at those aspects of it. Thank you for liking the live, Rastadi. So, we look at the environment and how the environment plays in. Then we also look at the mental aspects, the conscious mind, the subconscious mind, the primitive mind. Then we're going to look at the emotional aspects, right, of past traumas, emotional resilience, emotional, intelligence. We look at all of the emotions because those emotions can impact our physical body. Then we also look at the spiritual aspects, our connection to source, right? And whatever source may be for us. We're not talking about religion. We're talking about connection to higher self. We're talking about, our connection to creator, whatever it is we want to believe that's outside of ourselves. And then we look at the ancestral component. What's the ancestral component? We look at genetics, but we also look at our connection to our ancestors. So holistic holistic medicine encompasses all aspects of the human being. And again, this was a model that was shown to me in vision. And so bringing it all together, again, this is our original practice as Afro-Indigenous humans. We began practicing this early on. You will not find a Black person on this planet who has not had some sort of, been told to drink some concoction or take some craziness growing up. And so again, this is really a part of us, and it's very subtle energy. So we're dealing on more of those lower frequencies because we are very sensitive people. We're very sensitive souls. And so we need the sensitive aspects. We need a very delicate aspect. So holistic medicine is not fast. It's not rigid. It doesn't force, right? We come from a place of power. We motivate, inspire, educate people. And so that's why creating a whole other system, creating a whole other school, even though this is an old system, we're modernizing it and bringing it into the 21st. I guess we're in the 21st century. I don't know where we're at in space and time, but this is the kind of the basis of building the school. So in my graduate degree school that I've built is, we focus on holistic medicine, we focus on indigenous medicine, we focus on, these kind of lost arts, because if we don't continue to practice them and we don't advocate for them and we don't pass them down, sadly, we will lose them. They will just be erased and go extinct and be replaced with, shenanigans. And so we don't want shenanigans to be replaced. We want to really keep this integrity of working with the full human on all different levels. So that's what holistic medicine is, in distinction with all of these other practices. All right, a few more slides to go. Hold on one second. All right. So when we're looking at communication, naturally, we want to make sure that we communicate properly. Okay. And so formal communication allows us to communicate in a structured way, using similar terminology, using similar understanding, so that we're able to document things clearly, but we're able to have a specific framework and professional boundaries. This helps keep everyone safe, right? Myself, yourself, everyone's safe. When we use informal communication, right, we're using kind of street terms for things, it really muddies the waters. It makes it difficult from one professional to another, but also to formally trained professionals can recognize when there's informal training. So that person I was telling you about who's practicing without a license kind of thing, I can tell that they have informal training because of how they're presenting the information to the general public, because of how they're communicating, right? And that informal communication, again, is dangerous, because if we don't have a standardization, if one patient is referred to me because we're not all good at everything. And so, if one patient is referred to me and I'm getting their notes, if they even have notes, because that's the other thing, a lot of times in these informal models, they don't know how to properly take a case. They don't know how to properly, and that's across the board. I've seen it even in conventional medicine where they, in some of my functional medicine doctor groups, they're still using that diagnose and manage model. So they're still like, what do I do for this diagnosis? What do I do for this diagnosis? And I'm constantly like, we don't have any labs. You haven't given us labs. You haven't taken a proper case. How am I going to, as a colleague, how am I going to help you? Because this is an informal communication. This is not what we're trained in functional medicine. So again, you can see the distinction between somebody who's formally trained versus informally trained. And again, if we don't have a standardization, we can't communicate. We know language is limited, right? But if we're all speaking different languages, it's going to be even more difficult. And who's going to be affected? It's our patient. So there are hybrid approaches, of course. You can, have some educational framework for conversation, and you can balance that cultural sensitivity along with a more evidence-based model. But you still need to make sure that you document things appropriately, so that there's documentation. So if I am, let's say, faxing over medical records, like labs, I'm not going to give the conventional doctor my big old 45 plus page lab report that I do for my patients, because they're not going to understand all that stuff. I'm going to give them the raw labs that I get from LabCorp and fax those over, because that's what they understand. So I'm going to understand who I'm working with. I'm not going to come in and, oh, now I'm going to give you all this information, because I know that it's just going to bog them down, and inevitably it's going to impact the patient. So we definitely need to make sure that we have professional standards, but also some sort of aspect of communication where we're able to communicate effectively to each other as professionals, but also to being able to communicate with our patients. So it's okay if we speak to our patients in all kinds of street terms, but in those medical records, it needs to be more formalized, because if let's say, another healthcare provider needs to pull those medical records, they need to be able to understand what is written in those medical records to be able to help assist. And so, you could be hit by a bus tomorrow. And so, your patient is still going to be there, and they're going to need to be able to take their records and pass them around to people. So make sure that, again, that formal education is there. You can combine it with informal communication, but make sure that your charting and documentation is clear. All right. One of the things that we really want to make sure of in healthcare naturally is active listening. So communication is a two-way street, right? But communication, when I'm speaking, it's more, I'm communicating in a way that is going to get my thoughts and feelings and ideas and perceptions across, but also impact you in a way that leaves you touch, moved, and inspired by your communication. Now, in order for me to communicate back, I need to actively listen. What is active listening? Meaning I have to listen for and reliably deliver that which makes a difference. And so I can't know it all, right? I can't already be in my head thinking about what I'm going to say. If I'm listening to you, I'm listening to you and I'm not thinking about what I'm going to say. Instead, I'm actually being present to what it is that you're saying. Hey, strawberry cake. And so I'm being present to what it is that you're saying, and then I'm listening, right? For and maybe I need to take notes, maybe I need to write that down, etc. And so I'm not going to be sitting here listening to what you're saying and going in my head with 1,000 things. Instead, I'm going to put those, if I have something that pops in my head, I'm going to write it down so that I can be fully present to actually hearing what this patient says, because this patient is going to be telling me clues. And so if I am thinking in my head and I'm not actually listening, I'm going to miss things. So we want to make sure that I'm active listening and that I'm really curiously questioning is what we call it. If I have an idea, oh, something triggers, oh wow, that said something, oh wow, that triggered something there, oh wow, when I'm going to write it down, right? I'm not going to cut the patient off and then slice through what they're saying. I also want to set healthy boundaries with the patient, right? So making sure that I am off of the court, right? I'm not incorporating myself. So I do tell stories about my experience, my life, etc., but it applies to what we're discussing. So I may use it as a matching and mirroring and modeling technique, not necessarily just me venting and talking about myself, right? It has to actually be fit into what it is that we're talking about clinically. Otherwise, there's no collaboration. And then again, when we're working with our patients, it's about collaborating, not I'm superior and I know better and you're the patient and you know nothing. That patient has been in their body their entire life. They know more about their body than you will ever know. And so we want to make sure that you cut the ego, cut the pride, and actually communicate with your patient in a way that they are not only going to understand, but they're going to feel safe enough and trust you enough to be able to open up. Also, too, sometimes patients are just not your vibe. That's why I do a free discovery call, because there are certain people I don't want to work with, right? And I have that right. At 20 plus years in it, I don't have to work with everybody, right? If you're going to be difficult on a discovery call, guaranteed you're going to be difficult in treatment. And so I want to make sure that, we're on the same page. We can work in collaboration with each other. You're going to listen to me. I'm going to listen to you. We have a vibe back and forth. I don't want to be stressed, right? I don't want to be stressed I don't want to dread. I've had patients where I literally dread having to work with them. I don't do that anymore. I let go of people. I go, you know what? Go find this person, go find, but I'm not going to struggle with you. Either I'm your provider or not. And so making sure that you really work with yourself to get clear about who it is that you want to work with. When we do when we get into actually our holistic health coaching, one of the first modules that we do is actually in core values of your patients, meaning who you want to work with. You have to match value, right? So if a patient is not vulnerable, if a patient's not willing to be vulnerable, if a patient's not willing to be coachable, they're not going to be a good fit for me, because I'm going to point things out to them that may trigger them, that may impact them. And so because of that, I want to make sure, that they are vulnerable, they're coachable, they're interested in communication, and they're interested in getting well. You would be shocked at how many patients actually will fight you against getting well, because they get secondary gains, which means that they have certain things in their subconscious and their primitive that's holding them back from living their true potential. And so until they open that door and allow you in, you can be the most amazing doctor ever, world renowned, but you're not going to have that breakthrough with the patient, because the patient's almost like got their hands crossed and going, I dare you to heal me. And so I've recorded some videos about that when patients are resistant to healing. And so when we're on our break, I'll release those too. And you want to have compassion, empathy when you're working with people, because you've not walked in their shoes. You have no idea what these people, and patients will not just walk in and open up to you. I don't care how open you are. I don't care how empathetic you are. I don't care how friendly you may be. It will take time for patients to really reveal things. Deep traumas. It took me years to work with patients where they actually would admit that they had been through trauma or they experienced things, et cetera, et cetera, et cetera. And those were key pieces of their healing, but it took time for them to feel safe enough to be, okay, this lady's consistent, she keeps showing up, et cetera. And I don't push patients past where they feel most comfortable. Of course, I'm going to hold a person accountable. I'm going to keep them moving forward as best I can, but I'm not going to push patients, because that can cause more harm than good. So I definitely want to make sure I keep that open space. I do it with love, and I do it with integrity. Because honestly, you are trying to protect your patient's autonomy. And what is patient autonomy? They have to have freedom of choice, meaning they have to understand, hey, Zay, they have to understand exactly what's going on. So we offer informed consent. I know informed consent in the conventional realm is just not really being abided by. And so proper informed consent is, I'm, listening to what you have going on. I'm giving you all of the options, the benefits, the risks. I'm giving you the alternatives, and I'm pretty much putting it all on. I'm objective, right? I don't have a dog in the fight. I'm putting it all on your plate, and for you to make the decision. Like, for instance, with vaccination, people are like, oh, she's anti-vax. I'm not anti-vax, right? I'm pro-science. And so the thing with that is I have to look at the data for what the data is objectively. Meaning I'll look at the patient's genetics, I'll look at the patient's biochemistry, I'll look at the patient's, health history, I'll look at all of that, and then give that patient all the information. I'll give them the alternatives, to, the recommended treatment, and then they ultimately make that decision for themselves. I have patients that have vaxxed, not with me, of course, but with their peds, and I have patients that have chosen not to, right? It is not my job to sway anybody into one direction. It's not my job to force anybody to do anything. Coercion is coercion, no matter how you look at it, and that's unethical. It's not practicing first to no harm. So I make sure that I give patients objectively all of the information. I don't even say, oh, if it were me, da, da, da. No, I go, here are the facts. Here's what I found. Here's, the options. You let me know. And if you need to think about it, go right ahead. You'll find in the conventional world, they don't want the patient to think about it. It's very fast. So they quick. This is the superiority bias that's coming in. This is the confirmation bias. They already believe that this is the right thing for the patient. So there is not really proper informed consent in conventional medicine. I don't care what they say, because Number one, they don't offer an alternative because they don't know, they're not educated. But two, they will force a patient if a patient feels uncomfortable. So if a patient says, I need to think about, no, you need to move on this now. This is important. Da, 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 and they will literally threaten and force patients to participate in care. And so we want to make sure that in our practice that we protect our patient autonomy. We use non-coercive guidance. Even if we have a personal opinion about something, that has to be out of the way. There may be certain patients you cannot work with because you have strong held beliefs about something. I can't work with SA predators. I can't. If a person has past of essaying, that's just not me. I can't, that's not something I can work with. And I know that about myself, right? And so there are certain other things, like for instance, with the transgender community, right? Initially, I was like, I'm not going to work with them, not because I think any ill will for them, but because I didn't know enough, right? And so what did I do? I spent time. I spent, 6 months, 9 months in that area, almost close to a year, learning, looking at the research, looking at the data, speaking to people, being in the community, understanding, so that I could feel confident, right, to be able to work with that patient population. So I had to do my due diligence to be able to be effective for that population, rather than me going, oh, you know what, I can help it, because I don't want to cause more harm, right? So again, these are all things to think about and consider, as you're working with your patients and patient population. Bias is something that we all struggle with, right? Again, we have implicit bias, meaning we have assumption to certain things. We already assume, we already know, etc. So we have to work with that. Cultural assumptions as well, that we work on. We're blindsided by certain things. Again, knowledge bias. I already know, I already got this information. You don't know anything, right? I mean, I think one of the greatest things that I had was one of the doctors I train with, he said, Erica, you don't know anything. When I got my bachelor's, I thought I knew everything. When I got my master's, I realized I didn't know, as much as I thought I did. When I got my doctorate, I realized I don't know shit about shit. Aren't you on your second doctorate by now? And so that stuck with me, realizing I don't know anything. I have to be open to being wrong. I have to be open to listening. I have to be open to removing any biases that I have and deconstructing those biases. Because if I don't deconstruct those biases, again, those biases can harm that patient, i.e., the Black maternal mortality rate, 3 to 5 times more likely. Most of that is driven from unconscious bias and a lack of understanding. But there's a superiority bias in conventional medicine that assumes that it understands how to treat Black people and how to treat everyone. We are not the same. Our bodies are not the same. We cannot be involved in the same treatments. And so when we say, hey, I'm not comfortable with this, I'm not comfortable with that, instead of listening, we're called non-compliant, we're told that it's not working, etc., which is why being a part of an oppressive healthcare system is just not going to work, and in fact very, very dangerous. So this requires, in order for us to deconstruct, it requires us to be self-reflective. It requires us to look at and examine and say, okay, do I feel uncomfortable with this? What about me? Can I shift on this? Does this make sense to me? Does this not make sense to me? Etc. Talking to people, researching, going down different rabbit holes, because you want to deconstruct your biases, because your biases can harm your patient indirectly. So I cannot stress this enough, making sure that you're working with your bias. Please do not work with a patient population you don't feel comfortable with. You can definitely harm them inadvertently. We talked about this a little bit, but I just want to revisit this as we're wrapping up, because I have another call at 2:00. So informed consent. Again, what is informed consent? I'm being informed, right, of everything. I'm being informed of what the test results say. I'm being informed of what my theories are. I'm being informed of what recommended treatments are there, what the risks are, what the benefits are, right? And then we're having a conversation, and all of this is being presented to you as the patient. So all of that information is being presented to the patient. And then without coercion, without you're wrong, you're right, without shame, without any of that, right? What happens is that I, as the patient now, am able to take all that information, the test results, the opinion, the possible treatments, the alternatives. I'm able to take that back to, wherever I feel safe and comfortable, examine that, and then make a decision based on myself without any bias. Risk has to be presented, right? Not minimized. Oh, this is safe and effective. There is no treatment that is 100% safe and effective, okay? Because if you tell somebody that something is safe and effective, and then later on it happens that it's not safe and effective, now you've created betrayal trauma, institutional trauma, and iatrogenics, which is medical trauma, which I can tell you I treat. Probably 80 to 90% of my cases have some form of iatrogenics medical trauma, because they've been told one thing, but then they later find out something else. And why? Because we are not being given proper informed consent in the conventional healthcare model. I will stand 10 toes down with any doctor on this. We are not being provided full, proper informed consent. Full, proper informed consent would be us also stating if we don't know something, right? Which that rarely happens. Most doctors, they think that they are the big I am, they know everything, and they shame everybody else who doesn't think the same way that they do. That is dangerous, and it is costing people their lives. That is why it's the third leading medical errors, or the third leading cause of death. Why? Because of bias, because of lack of informed consent, right? And a lack of information. Patients know their bodies, and know their bodies better than anybody else on the planet. We need to start listening to our patients. When I put my medical books aside, right? Because in the beginning, I was so afraid. Oh my God. The first 4 years after I got out of school, I was so afraid. I'm going to harm somebody. I'm going to harm somebody. Oh my God. Oh my God. And so I would incessantly, after every patient, I'd look everything up. Oh my God, did I say the right thing? And then after doing that over and over and over again, I realized none of these patients fit in these damn books. Like, this is so nuanced. So I put my books aside, and I actually started to listen to my patients. Imagine that. And as I started to listen to my patients, they started to teach me more things. They started to go, I would love to eat healthy 24/7. I can't afford it. I'm sorry. I'd love to be able to not have fast food, but guess what? I'm busy. I got 3 kids. I'd love to, da, da, da. They would start to teach me what I needed to know. And then through that education, and through me humbling myself and checking my privilege at the door, I had to go, wait a second. You know what? That person, how can I get creative? How can I figure out a way to make this easier? How can I figure out a way to make this more accessible? How can I find a way to make this cheaper? How can I find a resource for this person, right? That is what hey Trinity, that is what someone does that really cares. And so that's why I have a column on Psychology Today, bringing care back to healthcare. Definitely check it out, because it's all about these conversations of care. We need to bring more. It's literally in the word health care, right? A lot of what people are getting these days is not health care. Hey, Kuma, a lot of what patients are getting is just insurance-based care. They're getting reprimanded. They're getting coerced. They're getting bullied. Thank you for the heart me. They're getting all of the things, right? They're not necessarily getting proper informed consent. Oh my God, Ty. My brain, I saw your thing and my brain didn't register. It's like people are not getting proper informed consent. And so we need proper informed consent. What is proper informed consent? I'm going to say it again. It is clear communication. When I am being told, right, all the things on the table, if this is experimental, if this doesn't work, if there's only 20%, if it hasn't been researched on Black people, if it hasn't been researched on women, if I'm just guessing, all of those things need to be presented, right? Instead, it's being presented, this is safe and effective. This is the most reputable thing. This is this. And then we're like, wait a second, no, we know that this is incorrect. And then when we go against the system, we are gaslit and told we're wrong, we're bad, we're non-compliant, all of these things, right? And then later on, come to find out we were right. And so then what happens is betrayal trauma, iatrogenics, medical trauma, etc. So how are we supposed to trust? Thank you for the heart me. How are we supposed to trust a system that literally is not informing us properly? No, it does not work. So demand proper informed consent from your healthcare providers. Do not be coerced. If you do not feel comfortable with the treatment, you say, you know what? I'm going to go home and think about this. They will bring in, I remember when I when I looked at all the information, I did not inoculate my daughter because of genetics, because of neurological. We had tons of mental illness in our family from intergenerational trauma. We had, metabolic issues. I was really concerned. It was playing Russian roulette. So I went to the doctor. They're asking, okay, are you ready for this? I said, I don't feel comfortable with it. I have one pediatrician say, you know what, you're smart, you're doing the right thing. I have another pediatrician who brings in the charge nurse, who brings in the administrator, who brings in the, again, trying to talk me into like this is a used car lot. No, ma'am. I said, I'm not comfortable. I said, I even had a dentist one time who was trying to sell me some enamel to put on my daughter's teeth or whatever. I said, well, let me look at the literature. And I said, well, I need to go home and look. Well, your insurance pays for it. Why wouldn't you want it? I said, because I'm responsible for this child. Because if anything happens to her, that's on me. Because I want to make sure that I'm not putting a poison in this baby's mouth. Like, hello, and so don't let these healthcare providers bully you. Also, in the natural world, don't let these natural people give you a shit ton of supplements with no explanation. There has to be data. There has to be understanding. It has to be measured. Okay, so your levels are this, your numbers are this is what's going on. I'm going to give you this treatment for this, and then we're going to check it. It's not just plug and play. You're not going to just be on something for the rest of your life. No, it doesn't work that way. Think back to before we were colonized. We weren't on a whole bunch of stuff all the time. No, we weren't. We were on food. We were on water. We were on air. There was all kinds of things, but it was natural. So again, a lot of money to be made out there. So please do not turn yourself into a science experiment. Do not allow people to just kind of do whatever. All right, I'm really going to have to wrap up because I'm late for a thing. Okay, so we're back to the beginning here, but just one more slide I want to go through, which is on health literacy. I cannot seem to find it. All right, cool. So health literacy. So you have to educate yourself. I'll leave you with this. You have to educate yourself, meaning that you cannot practice with other people if you are not living this yourself, right? Physician, heal thyself. If you are not I'm not talking about perfection, progress. If you are not working through your own biases, if you're not working through your own stressors, you're not going to be able to communicate that effectively to a patient. You're just not going to know the practical aspect. There's the book knowledge, and then there's the practical knowledge. So the book knowledge, obviously, you're going to get through school, but then there's nuanced aspect, right? I couldn't tell you all the things I learned about meal prepping and planning if I hadn't struggled with meal prepping and planning myself, right? Realizing that I don't want to sit on my Sunday and make a full week's worth of food because I'm going to throw it out on Wednesday. I don't want to, keep eating the same things over and over again because if I do, I'm going to get bored. There were a lot of things, nuance that I learned. So making sure that you educate yourself and you commit yourself to lifelong learning, because as you can tell, there's a lot to learn in this field, and you want to make sure that you keep on top of things, especially because it's so fast moving. There's so many different nuances of information that's happening, all sorts of things that you want to stay apprised to, that you want to stay educated about. And so I'm going to drop off because, again, I've got to run to another call, but I wanted to make sure that we got this education out today. It will, as always, be on the YouTube. I'm working to get all of this week 11 in the core shell. So give me a little bit of patience on that. So we are in week 11 of Intro to Holistic Medicine. If you want to join in our wonderful journey here, just click the link in the bio, scroll down, fill out the form, and away you go. It is a self-guided, self-paced course. All these courses are recorded, so you'll be able to have that information. Intro to Holistic Medicine 1 is a 12-week course. It's a foundational prerequisite course to a holistic health coaching program. Intro to Holistic Medicine 1 talks all about nutrient deficiencies, nutrient depletions, and how to identify those from a subjective, which is what the patient tells us, and objective, which is something outside of me, something outside of you, more science. So we do use science in this particular class. It is a science heavy class. In intro 1, we use nutritional assessment questionnaire to determine what our symptoms are. And then objective, we use our salivary pH as well as our heart rate to detect digestive issues as well as stress management. We will take a 3-week break. So next week is our final week of this class. So I can't remember what we're talking about, but probably something to do with integrating all this information. We will take a 3-week break in between. I'll still be going live and chatting it up with you guys and teaching, of course, about all kinds of different things, but it'll give us time, everybody, to kind of catch up, me to go through, make sure everything looks good and is organized. That way everybody can kind of complete their coursework before going into Intro to Holistic Medicine 2. If you're interested in Intro to Holistic Medicine 2, look out for more information. Intro to Holistic Medicine 2, we'll talk about detoxification. There'll be an environmental assessment questionnaire. We'll also go into urinary pH to look at detox levels in addition to our bowel transit time. So we'll be able to understand what the large intestines is up to, what's going on with that, because it's a primary eliminatory organ. We'll get into your primary eliminatory organs, your liver, your kidneys, your lungs, your large intestines, and your blood and your lymph. We'll talk all about those, as well as your secondary drainage pathways, which are your sinuses, your reproductive organs, and your skin. So we'll talk all about that. So thank you guys so much for participating, for liking, for sharing, for stopping by, for showing the love. I so appreciate you. I love teaching all of things holistic medicine. So definitely follow me if you want to learn more. Like, share, subscribe, comment. You guys already know what to do. I'm going to log off now on the Facebooks and the YouTubes and the IGs. See you all later.